So we're done with the owl, Todd?
Sorry?
Are we done with the owl?
Are we done with, yeah,
Yes.
that's the owl?
I'm sorry?
We're using it all.
Oh, we are still.
Yeah.
Oh, my God, I can't figure this out.
Which I
Okay, so she's still connected that way, okay.
So she wants to speak on
No,
it.
she hung up from the speaker. She's gonna connect through via WebEx.
You want me to unplug this so it doesn't ring or anything?
We'll just make sure it's on, that should be fine.
You okay, Jennifer? Oh, I was just about to ask, do you want me to go get that?
Thank you. I really don't.
Oh, okay.
I went to the room. Oh, my baby, come to the room. Rain's during the meeting, it's your fault.
Is anyone else who's got water? Mrs. Amelie, do you want water? Ms. Stevens, you got, no, it's one of you wanted water. Mrs.
Anybody else?
I
Oh, no,
have
all right.
mine, thank you.
I have water. Thank you. Just two?
What about you?
Yeah.
We seem to be right about at 6:30.
Yeah.
Are you sure? Okay, thank you. So just to be clear though, is he looking virtually or? No, okay, just want to be clear. Got it, thank you. This is my name, she has that. Okay, and I thought Mr. Everton, okay, yes, we're still good. Okay.
You got this fancy UNC board. Excuse me,
Well,
Sarah.
I don't, it's right there, it seems.
So we don't need it open.
I hope not.
No, one of our kids were at an event there.
Yeah,
We seem to, is not.
I don't throw away.
That's what I was
the
All right, I'm trying to get this
Make them, we
straight.
might as well use them.
Oh, you're recording. Are you all ready? Is it 6:30, 3?
So just to verify, we don't have any participants in the room that's logged into WebEx, correct?
Hold on.
Thank you.
Right, I'm not logged into WebEx.
Right, thank you. We will get feedback if you want.
All right, I'm ready to vote. Call me, Lord, I will be out. What do you mean? You know what, I don't need to get started. I'm calling the August 9th Orange County Schools Board of Education meeting to order. Good evening. I'm Brenda Stevens, Vice Chair, calling this meeting to order. Welcome to all attendees and followers. Thanks to the vaccinations and mitigation efforts, we are able again to meet in person. While we were able to return to a degree of normal, our battle with COVID is not over. We, the board, commend the courage and tenacity of our superintendent and staff for their selfless service during this past school year. We remain committed to providing an environment in our schools that is safe for in-person instruction. Chair McKenzie will not be with us this evening, and now I will read the public charge. The Orange County Board of Education pledges to its citizens to conduct its business in a courteous and productive manner, showing respect for fellow board members, staff, and citizens. The board asks its citizens to conduct themselves with the same courtesy towards both personnel and each other. As per board policy, Robert's Rules of Order will be used to conduct meetings. A moment of silence will be observed before each meeting. And now, please join me as we observe a moment of silence. Thank you. Dr. Felder, do you have any recognitions for us today?
I most certainly do. Thank you, and good evening, Vice Chair Stevens, to the entire board, to our students, staff, and families. Tonight, we want to recognize, next slide please, our 18 summer graduates. We closed out the 2021 school year with our summer graduation and would like to extend another very hearty congratulations and best wishes to our most recent graduates and their families. I would also like to thank our 3 high schools for their support of our summer programs to ensure opportunities for our students, particularly our summer graduates. Next slide, please. All right, so next, the Rotary Club of Hillsborough's annual Pancake Sale fundraiser for the 2021 school year yielded more than $10,000. This year, the Rotary Club of Hillsborough made sure every school in Orange County got a piece of the pancake. Pun intended. Principals from every school received a check to be used for their respective school in whatever way or ways deemed best to benefit their students and staff. So on Monday, August 2nd, in the J Wing of the Cedar Ridge High School, Rotarians and Orange County Schools administrators and board members came together for the official check presentations and a catered meal consisting of barbecue, baked beans, and more trimmings, dessert, and iced tea. It was quite lovely. More than 40 local sponsors helped to make this event a success. And on the day of the pancake pickup, hundreds of local law enforcement, first responders, and medical staff were delivered a delicious pile of pancakes, hot from the griddle. We are so thankful for the commitment of the Rotary Club of Hillsborough to the Orange County Schools Village and students. Without question, their efforts leave a lasting impression. Now, I will ask Ms. Melanie Stowe, Chief Public Information and Family Engagement Officer, to present the final recognition for this evening. Ms. Stowe?
Good evening, Madam Vice Chair, board members. It's an honor at this point to share with you that Orange County Schools was the recipient of 2 National School Public Relations Association awards. And these are 2 out of 86 in the country. And I'm sorry. Sorry about that.
The focus is on the minimize and not the PowerPoint. You just have to click on the PowerPoint presentation.
Perfect, thank you. So 2 of 86 in the country, and these, thank you very much. And what's really exciting is that this is not just we're communicating, this is really meaningful, these are meaningful projects and initiatives. The 2 award winners were our Equity Warrior campaign, and the second was the work of our family liaisons specific to the Parent Academy sessions that they held. And both of these awards had to acknowledge the research, the action, communications, and how we evaluated them. So I want to personally thank everyone who's focused, students and staff, on our equity focus, and also to our family liaisons and the work of our translation and interpretation department, because this is two evidence, this is evidence of their hard work. Yeah.
Thank you.
Thank you.
Thank you. So the next item on the agenda adoption. Will, did you want to do something?
Sure. I'd like to pull the literacy across the curriculum item from consent, and
Okay.
wherever you would like to insert that, Madam Chair.
Okay.
No preference.
All right. All right, we will pull that. Pull and we'll end up putting it at the end. It's just easier that way.
Sounds good.
Okay, all right, so next,
Motion to approve
Yes.
agenda with
with
Modify
the,
changes.
with the changes.
Second?
Thank you. So, any discussion?
And does that include, I may have to refresh the personnel report?
Oh, I thought we said we were
Are we gonna vote on that separately? Well, we need the rest of the report.
The revised personnel.
The revised, that includes the revised personnel report as well, correct? Was that your motion,
Yes,
Will?
yes, it
And was
is.
that your second? Okay,
Yes,
yes,
yes.
all right, I thought it was. All right, so there's no discussion, so all in favor, Will?
Yes.
Yes.
Sarah? Bonnie?
She's on
Oh,
WebEx.
are you shaking your head? Okay. Carrie?
Yes.
Dr. Moore?
Yes.
Brenda, yes. So, we now have an agenda. It's adopted.
Madam Chair?
Yes,
can we-
ma'am.
Can we do a voice check to confirm?
Yeah, let's
she can hear
try a
us and
voice check.
communicate? Bonnie, can you hear us?
Yes, and I've got it. Can you hear me?
Yes, we can
Yes.
hear you. And so, did you say yes to the agenda, Bonnie?
Okay.
She said,
Can you hear
okay.
me okay?
What?
Can you hear me okay?
I can
It's a
hear
little
you.
low.
Yeah.
I can hear you. Okay. I won't say okay. But I can hear you. But that's fine. It's good for, it's good for tonight. We can hear you. All
Thank you.
right. I have public comment on here. That can't be right.
Is there a way to increase the volume on that one? Okay.
Can we, okay. All right, it can't be. Well, the consent agenda is next. Did we approve the consent agenda? Yes, we did. Meeting minutes. Let me go to the next item.
I don't know if we approved the consent
We
agenda.
did not
itself. We
approve
just
the
approved
consent agenda. We need to approve the
Motion to
consent
approve
agenda.
the consent agenda.
Second?
All in favor? Oh, no discussion. So we have a motion to approve the consent agenda and a second. Bonnie, do you agree with the consent agenda?
Yes, with the change, right?
Yes,
Yes.
that's correct.
With the literacy report removed and the personnel report as revised.
Right. She said yes. Will?
Yes.
Sarah?
Yes.
Terry?
Yes.
Dr. Moore?
Yes.
And Brenda, yes.
And Brenda, so you know, I can see her from, we
Oh.
can see her from our angle. I don't think the other.
Okay, thank you. So, all right, so they're gonna watch you, Bonnie. And so that way, and you can signal if you have any situations. All right, let me get to my next item. Yes, I don't think that's right. Oh, Lord, that's my next item. Information, oh, the next item is safety guidelines and expectations. Is that the next item on
Yes,
mine?
ma'am, it
Yes,
is.
it
Yes,
is.
ma'am, it is for 40
I see it,
minutes.
for 40 minutes. Ooh. So
And I will
who is
note, it's had public comment earlier on the agenda, but you have it with each agenda item.
That's
is that
right,
correct?
each agenda item,
Okay.
right, each agenda item. So that's what threw me, so I had to mark it off mine.
Mhm.
So we're now at the information is safety guidelines and expectations to
Yes.
start the school year.
Yes, so tonight, staff will provide the board with a number of updates for discussion and feedback, and seeks the board's approval on the recommended guidelines and expectations to start the school year, as well as on recommended recruitment bonuses designed to help the district attract and retain exceptional staff. So Mr. Patrick Abilene, Deputy Superintendent of Operations, will speak to the proposed health and safety guidelines to begin the school year. He will be joined by Orange County Schools medical and healthcare partners who are well-versed in COVID-19. That would be Mrs. Quintana Stewart, who is the Director for the Orange County Health Department, and Dr. Danny Benjamin, Co-Chair of the ABC Science Collaborative, a Distinguished Professor of Pediatrics, Duke University School of Medicine. I would ask board if we could hold questions and comments until at the end of the presentation. That would help ensure that we provide you with all the information we have prepared for tonight. So with that, I turn things over to Mr.
Good evening, board members, Dr. Felder, and members of the public. One thing we know for sure with the pandemic, it's had a toll on families, it's had a toll on schools, and a toll on communities. The other thing we've learned during the pandemic the past year is information and guidance changes on a regular basis. This evening, we're bringing before you recommendations based on current health trends, research done by the ABC Science Collaborative in collaboration with the partners from the Orange County Health Department. We certainly have reviewed the Centers for Disease Control, the CDC guidelines, and the most recent updated Safe Schools Toolkit by the North Carolina Department of Health and Human Services. So we're guided by many appropriate sources for providing input and best practices to schools. We're bringing before you not all recommendations and information that will be shared with the schools and our parents, but the top ones that we have been asked to present this evening due to the urgency and the concern that we provide additional guidance and clarification. I'll step through and talk about each one, what the baseline recommendation is, any alternatives or exemptions that the board may consider so that you could provide input to the staff. Also, you'll be listening and hearing, as Dr. Felder said, from a couple of our medical professionals this evening, and then we'll have further discussion about the direction we will take as a school district. First is masking. We know, and you will hear probably several times tonight, that masking is a protective measure that works. Masking worked last year within the schools, and we are recommending universal masking indoors and outdoors regardless of vaccination status. And that would be both for students and for staff. There will be a couple exceptions to that. Like last year, certainly there was an exception for students that meet a medical exemption or have a physical disability that would prevent masking. That was an exception that would be in place continually. We know for some of our most vulnerable and at-risk students who have physical disabilities or specialized disabilities that didn't allow them to wear a mask in some of our classrooms, and Ms. Connie Crimmins is online tonight if we have any questions for her as well. Those processes would continue for those individuals this year as well. We know we allowed masking and students to take off their masks when they were eating with certain processes and procedures, and we'll talk about meals in just a couple minutes. So those items you don't see on there that were best practices from last year, we would continue to do that. However, we do know one of the areas where students were allowed to remove the mask, especially towards the end of the school year, was recess. And so we're going to talk about recess as part of these recommendations and why we feel masking should be considered in those settings as well. The next one is quarantine guidelines. There have been updates and changes to quarantine guidelines. We'll be following directly the North Carolina Department of Health and Human Services, the Orange County Health Department requirements for quarantine processes and quarantine procedures. Our staff understands that our administrators, teachers, individuals in the schools know when individuals had to quarantine last year, they were missing instructional time. We understand that. We know it's a high concern. We know what it does to a family to have to provide care for a student who's out of school for an extended period of time. That's why masking, our protocol for masking, our accountability for masking, the masking requirements are critical because the quarantine guidelines have been updated with some very specific language, and that's around, has the mask been worn properly? That means it completely and fully covers the nose, covers the mouth, no gaps, etc. So if there's a break in that, when we look at quarantine guidelines and quarantine processes, if the mask hasn't been worn properly, then we could be looking at a quarantine situation. We want to avoid that at all costs, whether it's a staff member or a student. Ms. Sylvia Compton, our lead school nurse, is online this evening as well. She'll be available to answer any questions in regards to quarantine guidelines. But I just wanted to stress the importance of masking when it comes to us looking at that. The second thing that will be important to quarantine guidelines is vaccinations. So that's our third item here to discuss. When we look at vaccinations, it's important to know what percentage of our population, the students, but also the adults. We're talking about school-age students who are eligible for the vaccination, those that are age 12 and above, who have access to vaccines at this point in time. We know that's a strategy that helps schools stay protected in the environment. So we want to look at and be able to track for quarantining and for corresponding with the health department when we have cases or concerns, the number of staff that may or may not be vaccinated, the number of students that may not be vaccinated on the campus. We will be asking to collect this information as part of our recommendations. It will be kept strictly confidential. Information collected from students would be shared with the school nurse. Information collected from staff may be shared with either the school nurse because they may be involved in contact tracing, which is part of their requirements with the Department of Health and Human Services, or HR, because our Human Resources Department and with Human Capital works directly with any protected or information on behalf of our employees. When we look at the other item here is we have requested and sent in the application for grant assistance from the state for the COVID testing protocol program for schools. We're waiting to hear final status of our application. That should be coming within days, like we're really hoping to hear this week. And so that would then allow us to begin the protocol for the testing. What the board discussed, I believe it was at the June 28th meeting, was the testing protocol and program for athletes. And so we'll have additional information this evening on that. I mentioned about employees.
Sure. And so with regards to employees, the expectation is for staff to apprise us of their vaccination status. Again, that information will be compiled by Human Capital using a portal that would allow staff to upload their information. And again, that would be kept confidential. And again, would prove helpful in the case of performing close contacts, any quarantining, and would just be helpful to know the percentage of staff in each building should we have to look at other measures with regards to ensuring staff and student safety.
As you discuss and talk about these recommendations here this evening, one that we will just ask for additional clarity, because when we talk about the testing of athletes, it does require parental permission. The second thing I will say to the board, and we've already talked with principals and athletic directors, we don't have the company yet, but we're working through that process once we get notified from the state. We will protect instructional time. We will find a way to test athletes before school, during lunch, after school, before games, practices, etc. We have to protect instructional time this year, and so that is our plan as we would put the process in place. If it has to differ, we will advise the board and let you know, but our goal is to make sure, because we know that's what you would want, is us to protect the instructional time. I wanted you to hear me say, we are going to protect the instructional time with the testing program. The second piece of that is because it requires parental permission. If a parent doesn't give permission, we will need to make sure we're clear this evening. Does that mean then the athlete is not eligible for participation, or they continue to participate but they're required to wear a mask? So I just want to make sure we have some clarity on the consequences if you're not tested. We do know some of the health information is centers around vaccinations and obviously the testing protocol. There could be a rare case where a student has a medical exception to both, where they can't wear a mask, but they also can't test based on a medical condition, let's say, that causes them to bleed if they stick a nasal swab up their nose. So that may be a consideration to think about as we talk about that requirement. Meals. Same protocol as last year, 15 minutes. At the end of the year, it's 15 to 20 minutes based on the current health and information. We're recommending we stick to 15 minutes because again, that's gonna mirror the guidelines for quarantine or exposure. No talking, students face the same direction. Those of you that ate outside last night, you know we had you facing the same direction, same protocol. So the expectation would be we eat outside within acceptable temperature ranges, and I put those in the abstract. Basically, if it's just above freezing or we get into a high heat category, we're gonna be outside to the extent possible. And if they're not outdoors, then we would use the classroom or use a hybrid model where they're in the class. Some students may be in the classroom, some students may be in another location. Just because we're not on cohorts this year, having 26, 28, 30 kids in a classroom still might be too many. And so we'll provide flexibility with the schools and making sure that we help them identify if they're not using outdoors, how they utilize the classroom in other spaces. And then the third option would be those large other spaces, whether that we have in schools and buildings. But again, the preference and the recommendation is, number one, we eat outside when temperatures are appropriate. We would allow students, like before, to bring a towel if they want to sit on, or teachers want to spread them out outdoors. We have been providing additional picnic tables. This board approved additional funding, and maintenance had been putting in picnic tables at locations. We've had several requests for picnic tables this summer, and I know staff have been fielding those requests as they come in. And then one of the things you'll hear me talk about is future capital projects. We talk about how to expand our learning spaces outdoors so that we have additional outdoor spaces for students to learn that also could be utilized for meals as well. We'll talk about that later in the month. Recess. Universal masking for all students outdoors. The concern is our youngest population are the ones who are not eligible for vaccination. Those students fall in the category where we're seeing rising numbers, and I'll let the health experts talk about those concerns. But inside the processes for recess, if they're outdoors, the mask is off, the students are inside 6 feet. And I've been an elementary principal. I have 750 students on my campus, ages 4 to 7. Trying to keep them separated more than 6 feet without a mask, I know is a difficult task for teachers and for principals. But anytime they intermix classes or they don't have masks on, we have risk for exposure and we have concerns. So if we want to take the safest approach possible, starting out this school year, especially until students understand routines and practices and how this works, especially for students who haven't been in school yet. We have first graders coming in who were not in school as kindergartners. Helping them understand, we're saying, starting out, let's start out with the highest level protection we can provide our students, and that is with masking, even if you're outdoors. Now, we could still have in place the mask break expectation where we allow students outside greater than 6 feet, mask comes off. In that case, we would say less than 5 minutes, more than 6 feet apart, except for to still provide a mask break. But the general expectation would be anyone that's outdoors, we would still have masks on except for other athletic programs as we discussed. Middle school and high school athletics. Quite a bit to kind of dive through here. Based on the research, we know transmissibility and risk is highest with this group of individuals, both on and off the field because of the interactions they have. We also know that you've already taken steps to identify this as being a high-risk activity by your requirement to have students tested or having their vaccination status known previously. What we would ask is the consideration, and we've got several items to kind of hit, but we would have universal masking indoors and outdoors regardless of the sport, and there are a couple exceptions that we would recommend to that. A potential exception would be for outdoor sports. Again, indoor sports, the recommendation is you're masked regardless of competing or on the sidelines. But for outdoor sports, to prohibit the wearing of a mask due to safety equipment, especially mouth guards, athletes would be exempt from the outdoor mask requirement if you allow that as an exemption. And then also for the time period when athletes are outdoors and they're actively participating on the field of play or in a competition, then if they're vaccinated or if they're being tested, so you would know if there's a potential of a COVID risk amongst your athletes, then we would allow those athletes to also be unmasked. You certainly could say, anytime they're in competition or anytime they're playing, they're not gonna wear a mask. But again, understand, at this point, we do not know the status of students, and we have not started the testing protocol. Our recommendations are we put the highest level of protection in place, and then we also can adjust those. And our recommendation is, based on your feedback and your approvals tonight, we would come back the middle of September. We will reevaluate as administrators, look at our cases, look at where we are, look at any additional recommendations coming down from all the individuals I mentioned earlier, and then we would come back with the board with an update to give you an update. With the athletes, we also would recommend that coaches fall into the same categories. So whatever we're requiring for athletes, we would require for coaches. So if we require athletes to be under the testing protocol, if they're unvaccinated, we recommend coaches follow that same protocol. And those are the items I had to cover this evening with the 5 or 6 areas on your screen.
Thank you so much, Mr. Otley. So if we could have our guests present, and so Ms. Stewart and Dr. Benjamin? Perhaps if we start with Ms. Stewart?
Sure, good evening. Thanks for having me tonight.
Welcome.
So I guess I'll just start out and maybe give kind of the current status in the county, and then I'll allow Dr. Benjamin to go into his presentation and share more detail. So as of this weekend, Orange County, we are now considered an area of high transmission, meaning we have had over 200 new cases over the last 14 days per 100,000 residents. So specifically here in Orange County, we had 233 new cases over the last 7 days. So that's just a week. Our percent positive has increased significantly. Last Monday, we were at a 3% percent positive, meaning the percent of all of our COVID tests conducted came back 3% were positive. As of today, we are now up to 4.6%. It's always been our goal to be at 5% or less, and if the increments that this percent positive continues to increase daily, I assume we will hit that 5% threshold before the week is out. So just wanted to share that the Delta variant, it makes up over 90% of our new cases here in the county. So we are not moving in the direction that I know we all probably had hoped we would be at this point as we were planning for school to reopen this fall. But we are, if you're following the CDC tracker, looking at the color of the maps, we are now red, meaning we have high transmission here in Orange County.
Thank you, Ms. Stewart. Dr. Benjamin?
Sorry, can you all, the first slide?
See if we can move. Can you move closer to your microphone there, Dr. Benjamin?
I sure can. Is that better?
It is, but we do have an echo.
I got the slides when he's ready.
Yep, slides up there.
Is that any better?
Is it we muted here?
If everybody else could mute.
We move?
No, everybody else in the call mute.
On the call.
Ms. Stewart?
Ms. Stewart
Ms.
should
Stewart
mute.
to mute.
you tell
That
me?
may be creating the feedback, is what he's saying.
Or body, or.
Please try again, Dr. Benjamin. Sure thing. Is that any better?
Yes, yes.
Thank you.
Great, thank you. So, let's see, things have obviously, as everyone on the call knows, has changed quite a bit in the past month with the emergence of the Delta variant. I'll cover some of that first, then get on to a couple of other topics. I think I have 9 slides, maybe. Go ahead, next slide, please. As you know, I'm with the ABC Science Collaborative, which is a partnership between Duke, UNC, and about 100 school districts in the state of North Carolina, and about an equal number of school districts outside the state of North Carolina. And it's upon our work that most of the current guidelines in the CDC are based on the data from the colleagues here in North Carolina and elsewhere in the ABC that provided the research for those data for the guidelines. Now, along the x-axis is the transmissibility of a virus or organism. Along the y-axis, it's at the log scale, so it's a little deceiving as far as mortality is concerned. There's really quite a bit of difference between mortality between Ebola virus and SARS-CoV-2. But you can see that the point of this slide is around transmissibility versus some other common infections that you might have heard of before. The original strain of SARS-CoV-2 had a transmissibility kind of measure called R0 of about 2, maybe 2 to 3. That means for each person who gets infected, they on average infect 2 or 3 other individuals. Now what's concerning about an R0 of 2 or 3 is that you get logarithmic expansions of cases, which at this time last year seemed bad. Unfortunately, the Delta variant has an R0 of 5 or 10, which means on average, every person who gets infected will infect 5 to 10 other people, which kind of makes you wish for the situation that we had last year. The good news is that it's not known. We don't have evidence one way or the other as far as greater mortality with the SARS-CoV-2. To give you some concept of what an R0 of 5 to 10 is, that's like similar to chickenpox. So for these school districts, a couple of them in North Carolina have already found they went without masking for 4 days, and they found out what it's like to have a chickenpox party in an elementary school. They had a COVID party, and they've since adjusted their mask policies. So the Delta variant is extremely transmissible. The good news for schools is it does not evade the vaccine, as best we can tell, so that's great news for people 12 and older. And second, the increase in transmissibility is almost certainly related to increased viral load. That is, it does not get through mass any more effectively, and it does not aerosolize more effectively. So there's not, just like last year, there's not a need to change ventilation around for this higher risk variant. Go ahead, next slide, please. So the main mitigation measures that we have, masking and vaccination, will suffice this upcoming year. Now, just as a note, as far as our track record is concerned, we've gone on the public record with firm recommendations in the past, in 2020, 2021, and those recommendations are now, have been backed by research, replicated by multiple researchers across different states, and are now accepted as guidance by the CDC and typically the American Academy of Pediatrics as well. We first discussed that children can attend safely in school and mask in August, about a year ago at this time. We then put out into the public domain that overhaul of ventilation is not needed if masked. That's now part of CDC and AAP guidelines. We put out that routine testing is not needed if masked. That's certainly with the original variant. Sports are safe if masked. In-person instruction is safer for children and adults than being at home. By October, we were putting that into the public domain. What we then called Plan A, which meant no distancing, is safe if masked. Busing with multiple children per bus seat is safe if masked. Sports, if masked, has somewhat higher risk, but is safe. That work has been not only shown to be through our research, but the research of other investigators researching independently at other school districts is now part of guidance. So what am I talking to you about today? Not only the Delta variant, the second thing is our suggestion that masking, like you did last year, is going to be what you want to do this year in pre-K through 12. And that if you want to keep your schools, open and staffed, that's what you're going to want to do. We've got one or two other brief things about sports as well. Go ahead, next slide, please. So this was our original hypothesis. This has been shown repeatedly to be true across healthcare systems and across hospitals and across medical schools and across clinics and outpatient clinics with poor ventilation and health department clinics with extremely poor ventilation, that if health providers will mask, they simply do not acquire COVID in the healthcare setting, and their patients don't acquire it. So this is a setting where patients come in, infection status is unknown, they wear a cloth mask typically, and the healthcare providers wear either a cloth or medical mask, not an N95 mask, just a routine mask. And the cumulative incidence is that red line. You see it going flat. Once you put in a mask mandate, you simply don't see the transmission in the healthcare setting. And that's been replicated over and over and over again, including with not only contact tracing, but testing and genome-wide analysis, and now has been replicated in school districts across the country. Go ahead, next slide, please. That masking in the healthcare environment continues to be effective in the face of the Delta variant, and masking over summer school in school districts in North Carolina. We haven't released these data publicly yet, but we had 19 school districts in North Carolina share their data with us. There was very, very limited transmission despite the Delta variant in North Carolina over the course of summer school this summer, as well as from our colleagues in Los Angeles. Those data also not yet publicly available. They just shared that with us on our weekly phone call that we have with our colleagues doing research across the country. So what happens when we don't mask? This is less of an important slide for, say, Orange County than it is for some of the other counties I've been in front of, but just let me run through it quickly. What happens if we don't mask is we're going to get a bunch of COVID in school. That was seen in Israel, where the secondary attack rate is between 13 and 16%. That was in August of 2020. In Springfield, Missouri, they tried to go unmasked in a research project that they had going with Washington University. That was a bit of a disaster for them. A couple of weeks later, they shut the study down early, and in order to keep the schools open, went back to a mask mandate at the beginning of July. I think you all have seen in the press, I don't have access to the last two bits of data, but I think you all have seen in the press the charter school in July of 2021, which I think made it 4 or 5, maybe 6 days without masking, and the school district in Mooresville graded school district, which I think made it 4 days without masking in place, and ultimately had to put masks back on. In the mask environment in North Carolina, it's really over and over and over again, less than 1% secondary attack rate across over 1 million school children and adults in the fourth quarter of 2021 without distancing. And in the masked environments nationally, those work has been replicated in Utah, Wisconsin, Nebraska, California, etc. Georgia. Next slide, please. So it's really pretty simple. We have two solutions: vaccination or masking. Vaccine really prevents severe disease, right? Just simply being infected is clearly not good for spread, but ultimately what's important about COVID is preventing severe disease, and the vaccine does that, preventing severe disease well into the 90s, 90 some odd, 92, 95, 99%, depending on what study you look at as it relates to death and severe lifetime morbidity. It's safe and effective for children 12 years of age and older. Unfortunately, The community of Orange County Schools is not adults who are eligible to be vaccinated nationally. It's not the eligible citizens in Vermont, which have a vaccination rate of greater than 80%. It's not even the adults in Orange County, which we could maybe get them to approach 80%. That'd be awesome. The community is actually children and adults in Orange County schools, pre-K through 12th grade environment. And unfortunately, most of that community does not have access to vaccines. That would be the pre-K to 6th graders. And approximately 40% of the community that has access to vaccine is unvaccinated. So the community right now as a whole is about 20 to 25% vaccinated. It does no good for Central Elementary School, Hillsborough, for there to be a very high vaccination rate in Orange High School or Orange County broadly, any more than it's good for Central Elementary in Hillsborough to have a high vaccination rate in the state of Vermont for physicians at Duke University Hospital. So vaccination, unfortunately, is, we need something to get us there, and that's masking. We need a stopgap, and really, if we can get folks vaccinated, we're really going to have this stopgap for not too terribly much longer. Or as long as folks would like to remain unvaccinated. Go ahead, next slide, please. So I didn't ever anticipate really having to talk about microchips and vaccines, and I won't go into that today, but I think it's worthwhile to give a little bit of vaccine history, because I do hear over and over again, gosh, what if there's a problem a year or 5 years from now with COVID vaccine? Okay. So there's such things as safety event in the life cycle of the development of the vaccine. So you can have safety events that come out early, and that's when the vaccines are under study before they're licensed. And you typically study these vaccines. Vaccines typically get studied in 20 to 50,000 people before they get licensed. And an example of this in the 1960s was with the RSV vaccine. It actually caused more severe disease in a study, and the whole development program was shut down. That's an early in the life cycle of the vaccine adverse event that you found out. You can get adverse events middle in the life cycle of the development of the vaccine. And this is when you give it to, say 10 million people or less. And your product's been licensed, and you're now giving it to millions of people. And this is uncommon, but the best example of this is the rotavirus vaccine, happened about 20 years ago. Late in the life cycle of the vaccine, you've given the product to more than 10 million people, and you find out, oh my gosh, this causes an uncommon and rare event, and it took us 10 million people to figure this out. It's very, very uncommon, but it has occurred. Some children with severe combined immune deficiency syndrome with receipt of oral polio vaccine during the 20th century. That's why we moved people who were older than 30 or 40 years of age got oral polio, and people younger than that got it injected as routine in this country. So that's in the life cycle of the vaccine. And for that polio severe adverse event, it was occurring at the rate of a couple per million doses of vaccine, like on the order of 1 per million doses. So it was a very unusual event that took a while to figure it out. All right, we've now given the COVID vaccine to hundreds of millions of people, hundreds of millions of doses. So we're beyond that point as far as the life cycle of development. Now, what about events relative to the administration of the vaccine? We have early events. I get my vaccine on Monday. I might have an event in 24, 48 hours. I get the event on Tuesday. That's pretty common. Anyone who's had 2 doses, who's had, we have a family of 6, a couple of the kids in the house, had fever, headache, threw up, all sorts of good stuff after they got their vaccine. Good times. Right, that's pretty common. That happens about 30 to 50%, depending on your vaccine. Middle, I get my vaccine in March, and a week later, I get an adverse event. And that can be seen from time to time. People can experience that. you know, it's reasonably, it happens, late. This is, I get my vaccine in March 1st, and then in March, April, or May, maybe even, you know, by the 1st of June. That's uncommon, but that will happen from time to time, 1 week to 3 months. Longer than 6 months or longer than a year post-vaccination for the event to start. So in the history of vaccinology, going back to smallpox, over 100 years ago, we've had thousands of vaccines investigated. We've had hundreds of different vaccines licensed. We've given those vaccines to tens of billions of people worldwide. We've given hundreds of billions of doses. When people are talking about what might happen 5 or 10 years after receipt of vaccine, just has not been reported in the history of vaccinology. Okay, go ahead. So extracurricular activities in middle and high school, the overarching goal, of course, is to ensure the health and safety of students, providing opportunities. And COVID transmission is higher in extracurricular activities and classroom activities. That's very clear. Patrick mentioned this earlier. We've shown that about 50 to 75% of within school transmission in high school occurs during athletics. It's about 75% of the sports are indoors. Of course, immediately folks after that said, well, what about outdoors? And in the Plan A data from the 4th quarter of 2021, when we were having outdoor sports, it was about 50% of the high school transmission, within school transmission, was in outdoor sports. And outdoor transmission and super spreader events are clearly happening with the Delta variant. Now, several states required masking during athletics in 2021. That was successful. Several states required twice weekly testing in 2021. Once weekly is probably not enough, but twice weekly testing with the availability of safe and effective vaccines. You guys have now the third tool to help us offer extracurricular activities safely. Go ahead, next slide, please. And so, if I had to say, you know, what is the best medical advice, the safest medical advice I can give you? Remembering that the goal is we want to provide a safe environment for children. We want to avoid morbidity and mortality in children. The safest option medically is vaccinate as a condition of participation. By far the best option medically. It's the safest option to prevent severe disease. The probability of death in a student athlete from COVID is now reduced to, you know, less than 1 per million post-vaccination. This really is the best way to go. I know that there would be folks that be very, very, very upset with that approach. So I always get asked about, well, what about other plans? Oh, sure. If you want to go second best option, you enjoy accepting a little bit of risk, that option's available here. And so vaccinate or mask at all times. That was done last year. That's a very reasonable plan. We promoted it last year. Plenty fine plan. One of the logistic problems that, you know, athletic directors and coaches can sometimes have is like, who's masked, who's not, you know, who should be masked, how do I enforce this? This will substantially, you know, reduce the risk of acquiring disease, but does not change if you acquire disease, whether or not you get severe disease. You can vaccinate or test twice weekly. This is also, it's reasonable, probably not quite as helpful in reducing transmission. That's actually unknown with the Delta variant, so, you know, I could see this as a reasonable a reasonable pathway. You're gonna get some increased transmission if you follow this pathway relative to vaccinated as a condition of participation. You're gonna have, increased risk of severe disease, because you're gonna have some kids playing that are not vaccinated, they're gonna get it, but, you know, that's, I think, a very, you know, it's a reasonable pathway, and it's far, far superior to, the next pathway, which is a popular pathway, which is, cross your fingers and hope for the best. This puts the children and staff at highest risk, but it is a popular plan. It's likely to result in the death of several students this fall in schools. The good news is, for a school district that has only 6,000 students, you probably won't be responsible for the death of a child this fall, if you follow this pathway. But which might. If you're going to go with the cross your fingers and hope for the best, you might want to work with your communications team on how to message that if such a tragic event occurs. The policy really should be extended to all extracurricular activities, such as theater, band, chorus. These are unmasked settings typically, and these are also voluntary school-sponsored activities. And I think with that, that's my my last slide.
Okay, that's 40 minutes. All right, so now, what I'd like to do, I know you all might have some questions or whatever. Do you have some questions for Dr. Benjamin? All right, so you can ask your questions, but before, go ahead.
Do we have any comments?
Yes, we do.
Okay.
That's what I was
Okay.
I'm gonna get there. We do
Okay,
have
sorry.
several people who'd like to comment. But what I was going to suggest is that we take our public comments first, and then you all can have your questions and do, okay? Before we call public comment, we have our public comment document that I must read. The Board of Education, as an elected representative body of the school district, wishes to provide a forum for citizens to address the board with public comments, to provide an opportunity for input while conducting an orderly meeting. Individuals or groups may be heard by the board in accordance with this policy. Limited time for public comment will follow each work session item. Comment will be restricted to the topic of each work session item. The total duration of public comment at a work session may not exceed 1 hour. A person wishing to address the board on a work session agenda item for that meeting must sign up prior to the board's work session by signing her or his name, address, and the agenda item on which she or he wishes to speak. Comments will be limited to 3 minutes. When the 3 minutes end, the speaker must stop speaking immediately. Yielding time to another person will not be permitted. The board will not have a discussion with any speaker. No profane or vulgar language will be permitted, or personal abuse against any person. The board vests in its chair or other presiding officer the authority to terminate the remarks of any individual when she or he does not adhere to the rules that was stated above. Matters involving specific employees are protected under state law, and matters relating to specific students are protected under both state and federal law. Public comments should not address any specific confidential student or personnel matter. So now we will, I don't have the sheet. Thank you, Melanie, just go on and call it. Okay, thank you. Mrs. Stowe, yes ma'am?
Mrs. Stevens,
Yes.
Dr. Benjamin just mentioned that he will have to leave soon. And so I know that we want to shift to public comments, but I just wonder if we could perhaps just before we do allow opportunity for any questions posed directly to him, or do you want to let a few of the comments go and then?
I'd like to because we have
Okay.
a lady
Yes.
sitting right in the corner, and I'd
Oh,
like
I'd
to.
love to ask Dr. Benjamin a question if you'll let us.
No, that doesn't work that way. I'm sorry, as I read, yeah, so we would like for you to, make your comment, ma'am, rather than having to wait.
That's fine, whatever
Okay,
you
the,
want.
first speaker is Bethany Lee.
Thank you.
Hello, my name is Bethany Lee. My husband and I are both RNs, and I may not be as smart as these gentlemen seem to be, but I do have some common sense. First, I'm gonna bring up a couple of issues that I have with these gentlemen, what their talking points were. First, you don't have 5, 6, and 7-year-olds wear masks properly. It just doesn't happen. So let's just kind of get past that part. VAERS reports, I want you to look at the adverse reactions in VAERS reports to the vaccines. We're also talking about preventing severe disease, not preventing getting sick. Children get sick. We all need to realize that we are not going to stop children from getting this virus. Besides that fact, there is no testing for the Delta virus available. There is genome sequencing, which you can do to determine the Delta virus. However, they do not do that in normal testing. So how do we know how much Delta virus is being spread around? Those are the first couple of things. Now, I'm gonna say, shame on all of you. I am disgusted by the perpetual power grab of this board to take decisions out of parents' hands. You are continuing to make mandates on masking without the science to back it up or the consent of the parents. Even the CDC shows that there are more deaths from influenza than COVID. You have given no measurements to when this will end. You have started it March 2020, and here we continue to go. You have made kids eat outside in 90+ degree weather. You have given no hope to our children as when they're going to return back to normal. You are making healthy kids test just because they don't have vaccines. These vaccines are only 8 months old, and regardless of what anyone says, parents should be careful about what they put in their children's arms. This is the right of each individual, whether or not they want them. And I feel this is your way of forcing the vaccines on these children. If we're going to be keeping people from getting sick, why not test for strep every week? Or maybe we should use spinal taps on children every week for meningitis. Ever think about that in the Pandora's box you're opening? I have a letter from Dr. Rosemary Stein, who is a physician in Burlington. Her and her husband, Dr. David Stein, have been pediatricians for over 30 years. I'm going to read you some of her letter. Quote, first of all, we saw very little transmission of COVID-19 from child to child, nor child to adult throughout the pandemic. And the entire time since the pandemic began, only 2 of our 5,000 patients were hospitalized due to acquiring COVID and becoming sickened from it. She continues, quote, it is our conclusion that masking has not been helpful whatsoever in limiting the transmission of the pandemic. Then she talks about the effects of masking. Quote, our patients have become more depressed, anxious, and withdrawn. Their mental health has suffered, resulting in spikes in psychiatric hospitalizations, suicide attempts, and deaths due to suicide. This is a well-known and cited outcome to COVID management, including mask wearing and social distancing in children, unquote. We have done it your way for 17 months, but I think it's time that we put the power back in the hands of the parents. I'm willing to do whatever it takes to get optional masking in this county as well as it is in 20-some other counties in North Carolina.
Could you bring it to a close?
I'm sorry?
Your 3 minutes are up, could you?
Yes,
close
I
it? Thank you.
am right here.
Thank you.
You have given no metrics as to when you will decide to give power back to the parents. You have not given us any kind of time limit of when we are going to see our kids get back to normal. And I think that everybody who does not take that in consideration needs to be replaced. Thank you.
Thank you. So since our other speakers are not here, I would give Dr. Benjamin an opportunity, employees, board members, an opportunity to ask your questions. Thank you. Before he leaves. Sarah.
One thing I'm wondering is, in terms terms of the outdoor masking during sports, whether there are any like particular sports where by nature of the sport, they are generally 6 feet apart all the time. I'm thinking of like tennis or cross country, and whether there might be, whether there have been any particular sports where we've seen where we've seen very little transmission so far in North Carolina schools.
Mhm.
Dr. Benjamin, we can't hear you.
Sorry about that. We don't have sport-specific data. The initial speculation was that wrestling and basketball would be really the two most problematic. Wrestling, basketball, and cheer would be the most problematic sports. But it turns out it certainly occurs in the outdoor sports as well. And so some of our speculation that soccer or baseball or football would be substantially lower risk didn't pan out during the winter or during the fourth quarter of instruction as we thought that it might. And I can speculate based on other public health interventions. I'm going to go from data to now speculation based on just public health training and speculation. And I mean, it's public health training and experience. What happens when you start to give exemptions, you essentially get leaks in your public health mitigation. Public health mitigation measures tend to be very simple, very consistently enforced. And so when, say you have an event where you say, well, I'm playing tennis and I'm here 30 feet away from others, the kids get to the sidelines and they don't really don't have as high a fidelity as having their mask on. And we saw this certainly in baseball, where you would look out at a right fielder and you think, how in the wide world of sports can that child infect another child? Well, they come to the sidelines, and if there's not universal masking throughout the period of the game, they tend to have decreased fidelity with their masking throughout the sports experience on school property. If you have vaccination in place, obviously you can get transmission of virus, but you prevent acquisition of severe disease, which is why I view kind of vaccination as a reasonable option for these school sports to do.
All right, thank you. Yes, Carrie.
Dr. Benjamin, I was wondering if you could speak to breakthrough infections, because I think a lot of us have read articles recently and were surprised by the viral load in the nose and throats of vaccinated individuals with breakthrough infections. Appears that it could be similar to those in unvaccinated individuals, but the rationale for testing unvaccinated individuals, in my understanding, is that the percentage of those breakthroughs in vaccinated individuals is still in the single digits or low single digits. Is that correct? Could you explain that?
Yeah, it's early with Delta. I don't have, it's really early. So a couple of things. One is, you'll read papers or stuff in the newspaper where they talk about cycle time, and the cycle time can be relatively close between vaccinated and unvaccinated folks. It does not necessarily mean that the vaccinated folks have as much infectious competent virus. It might, but that's can't quite be translated that way as you see it in the popular press.
Okay.
Number two is, it's when the original when the data from the vaccines came out for the original strain from 2020, it was a very pleasant surprise that the vaccine worked to prevent acquisition of infection. We were very skeptical that that would happen. We were very skeptical when those data came out. To see folks continue to get the infection with vaccination is actually what we anticipated from the beginning. And I think if you go back to prior board meetings, you'll see that that goal of, well, we probably won't have a bulletproof vaccine, but if we can just get something that prevents severe disease. So I really do think long-term that's what we're going to end up with. There is some protection from infection, substantial protection from infection. It's just not nearly as good as it was with the original variant. The precise amount of protection depends on if you read the Israeli data, where it looks to be low, the UK data, where it looks to be maybe a little bit better, versus some of the American data, where it still looks to be pretty reasonable. So I think that as far as the vaccine is concerned, the long-term strategy as it relates to vaccine is that it gets us away from a lot of the other public health mitigation measures. It eventually will get us away from that because we will prevent severe disease and because we will prevent emergence of a breakthrough variant with higher mortality and the one that escapes the vaccine. It's very clear that and it's been consistent throughout the American data, very, very consistent around the American data, that the vaccine prevents severe disease, death, and hospitalization up into the high 90s. There's some reason socially and culturally and kind of life in Israel. We were just talking to our Israeli colleagues with whom we collaborate this morning as to why the data from Israel is looking quite as good as the Americans, and it's why the Israelis have gone ahead and decided to go with the third dose. So I would say prevents death, very outstanding, high 90s percentile. Same thing with severe morbidity, same thing with severe morbidity linked to hospitalization. But we're still going to get infections with the vaccinated folks.
All right, thank you.
Thank you.
Mr. Atherton, did you have a question for him?
I do. So the question I had is, can you talk about the efficacy of a wet mask, or what are the problems with that? And the context of this is, I'm thinking of these sports like football, where people are profusely sweating and the mask will get wet, and the CDC guideline says immediately swap it out. So I'm just curious, is there data around the efficacy of a mask when it gets wet?
Well, some of the disposable masks will start to deteriorate when they get soaking wet, and so that's why you see part of why you see that swap out recommendation. And really, when you're talking about protecting your student athletes from severe consequences, that's why I keep going back to really, you're going to want those kids vaccinated, because everything else is going to be not quite as good. It is clear, however, from last year's experience, that when districts mandated masking in their sports, they had a much lower rate of, they were able to provide a very safe environment for those kids in those sports. The transmission rate was substantially higher than the classroom, but much lower than in the, what you'll see in the unmasked, much lower than the unmasked setting, for example. And it's a huge, huge benefit relative to what you're seeing in these schools and school districts that have tried to do this without masks.
So I do have a follow-up on that. So what about, you know, in the original charts we were sent, it looked like the recommendations was all student and extracurricular activities to wear a mask at all times unless they are vaccinated, meaning they didn't have to wear a mask. Is that still your recommendation, would be if you're vaccinated, not to wear a mask in sports?
Well, I think once you've got your kids vaccinated, you're preventing severe disease, which is the goal. And at that point, you know, if you've got all of your kids on a team vaccinated, I'd leave them alone and let them play.
Is that your question? All right. Do you have any further questions from Dr. Benjamin from board members?
I do, Brenda.
Okay.
I have a couple. First, just on the outdoor sports events, what kind of absolute number? You said about 50% of the incidents are outdoors. What are we talking about in terms of absolute numbers? Is this, you know, you said less than 1% of the kids are, well, anyway, what are we talking about in terms of absolute numbers?
Yeah, let's see, your secondary attack rate in there is probably, instead of, if you're masked, okay, if you are masked, your secondary attack rate in outdoor sports is a couple of single digits. So rather than being less than 1%, you've got a secondary attack rate that's substantially less than 10%, but substantially more than 1%. So I split the difference there.
Okay, I was just wondering if there's, okay, in a
the
high.
absolute numbers, and I'm sorry for being a little bit dodgy on that, but the absolute numbers are going to be driven by how much spread is in the community, right? Because that's what drives the original, that's what drives the kid. The higher your community transmission is, the more you're going to have people coming in to potentially expose each other, the more your total cases are going to be. As a school, you can't control that. As a school, what you control is prevention of one child coming in sick, infecting another child on school property. And right now, your incidence is much higher than it was in May. The community incidence is headed back toward what it was in February.
Right, right. All right, so then my other question is on the, you know, you didn't speak much about the K-6 group. And first question is, what is the expectation at this point for a vaccine for the younger kids in terms of timing? At first we were thinking it was coming in a month or two, and now it's looking later. What is the current thinking on that? And then the second question is, we have like Hillsborough Elementary is already back, and those students are outdoors in recess unmasked. So, and we're not seeing, we are having a couple of cases, but, you know, you're suggesting that we now ask them to mask? Is that what you're saying is?
Right, so two different things. One's around the vaccine. So The data for the 5 to 11-year-olds is, we've heard repeatedly that it will be submitted in September. When the data from 12 to 15-year-olds came through, we knew that unless there was something extraordinarily surprising in 12 to 15-year-olds, we would have an emergency use authorization about a month after submission of the data. Here, the 5 to 11-year-olds go under a different regulatory pathway, as you know, which is you've got, unlike the 12 to 15-year-olds where you could use the same dosage so that you could then extrapolate a bunch of different outcomes from the adult data, the FDA may look at those data that Pfizer submits, and they may ask for additional time, or they may ask for additional data. So there is a non-trivial probability that we could see them, the FDA, delay authorization beyond the fall of 2021. And I don't know, I can't give you a good probability of that because I haven't seen, I'm not involved in the vaccine trials themselves in the 5 to 11-year-old group, and I haven't seen the data. So it's, my hope is in calendar year 21, we'll have the authorization, but if we get some bad luck, we'll end up pushing that out to 22, early 22.
Okay. Is that your question, Bonnie? All right, so do you have another question?
The other question was, the kids, we have kids right now that are in school, we have a year on school, they're playing outside, unmasked, and are you suggesting that we ask them to put their masks on now?
Yeah, I think, the outdoor setting, I'll tell you a couple of things. One is with the Delta variant of having an R0 of 5 to 10, you'll have some increase. I don't have a strong opinion on that specific question. And I'll tell you why. That Delta variant, it really depends on if the R0 is like closer to 5 or closer to 10. And we don't know that yet. A part of that is how much are the kids clustering in the recess time. If you've got 12 kids huddled up and sitting in each other's laps, looking at each other's iPhones, that's a much, for the whole recess period, that's a whole different kettle of fish than a bunch of kids running around with some distance from each other. I think that, when Wake County asked me this, I said, if you've got a little bit of risk tolerance, which Wake has consistently had during the pandemic, they went to Plan A in second quarter of 2020, whereas not everyone was even in school in Orange County. Then they went to Plan A for all students in Q4 of 2020, when Orange elected to be in Plan B. Wake has consistently been a little more risk tolerant. I don't mean that in a good way, I don't mean that in a pejorative way. It's just, y'all's two boards are a little bit different, right?
Yeah.
And so when Wake asked me this question, I was like, well, given what I know about your board and given what I know about your staff, I think either way is kind of reasonable. I suspect you guys are gonna be unmasked at recess. When I think about Orange County's behavior last year, I think either way's okay. I suspect y'all are gonna be encouraged by your staff and by your health department to mask up outside. And that is also a very reasonable plan. And because you will get some more transmission if you're if you're unmasked out there. However, it's young kids, it's outside. I have uncertainty about whether, again, the exact transmissibility about the virus. So this is going to be one of those questions where, you know, the best answer for me is, you know, I don't have certainty to provide to you. And I think reasonable people can disagree.
Thank you.
Okay, thank you. Thank you so much. Now, we're gonna go back to the public comment section. And Ms. Stowe, would you please read the name of the next person? And
Thanks, you all.
thank you, Dr.
Thanks,
Benjamin.
Dr. Benjamin.
Dr. Benjamin, and thank you,
And Ms. Stewart.
Ms. Stewart. Oh, that's for sure.
Okay, if our IT folks could unmute Jen Reed.
Thank you.
She should be unmuted and ready to go.
And if someone will keep the time, thank you.
Good evening, Dr. Felder and Orange County School Board. I'm a parent of three, a second grader and kindergartner at HES, and a baby, hopefully a future HES Dolphin. I have an MPH background in public health research and health behavior, have worked in public health organizations for my professional career, and served on the OCS COVID-19 task force last year. Our children have been back in school for 3.5 weeks. COVID student cases and close contacts at HES are being reported. Orange County COVID cases are rising. Each day we're more concerned sending our children into school where children and an uncertain number of staff are unvaccinated. Unvaccinated children across the South are being hospitalized and admitted to pediatric intensive care in rapidly increasing numbers. Even when children don't get sick enough to require hospitalization, long COVID and its neurological complications are very concerning. We're still gathering critical data about how many children will be affected. Currently, the OCS COVID mitigation strategies are not robust enough to combat the highly contagious and dangerous Delta variant and must be immediately updated. Delta leaves no margin for error. We're subjecting our kids to unnecessary health risks by using these outdated strategies. Please provide tight-fitting, higher filtration masks for students and staff who need them. Cloth masks, which many of our children wear in school, are often not as tight or as efficient as higher filtration masks, such as KF94s and KN95s. For example, the state of Utah is providing KN95s to all students. Ensure school ventilation and air filtration systems are top quality. Provide more outdoor shelter areas. Mandate COVID vaccines for eligible staff, especially those serving children too young to receive the vaccine. Provide school-based routine COVID testing opportunities for students and staff. Update the definition of close contacts and outdoor masking requirements to reflect Delta's high rate of transmission. Create specific measurable criteria by which schools may pivot to Plan C, as Orange County has high community spread with our unvaccinated kids at high risk. Finally, please reconsider your policy forcing families out of their spots at OCS choice schools if they join the online academy or homeschool until vaccines are available for younger children. Older children under 12 are already established in their school, and younger ones are making invaluable connections to their community daily. If you can't guarantee a return to school of choice after a period of virtual schooling selected by families to ensure health and safety of their children, please provide priority status when reapplying. We're facing an unprecedented virus strain with known and unknown long-term consequences for kids. We're conducting a health experiment with our kids. Families shouldn't feel forced to send children into Plan A school for fear of losing their school spot when it might not be the safest option for them. OCS is committed to ensuring that children thrive, receive consistent education, and succeed long-term. The loss of a child's spot in the familiar school community they're thriving in will create unnecessary disruption, trauma, and loss for their long-term educational experience. This policy creates yet another cruel COVID casualty. It's unnecessary, and there must be alternate solutions. In closing, I've appreciated your transparency and commitment to following the science. Please continue this. Thank you.
Thank you. Thank you very much for adhering to the 3 minutes. Next, Ms. Stowe.
The next speaker is Laura Strikefield.
Yes, hello, can you hear me?
Yes, your 3 minutes starts now.
Thank you. I really appreciate the opportunity to speak, and hearing the other speakers and Dr. Benjamin's comments, it does strike me that there is a lot that's still unknown, and I really appreciated Dr. Benjamin, including that, there's still a lot that we have to learn about Delta. With that in mind, I'm quite concerned that there's an opportunity that's not going to be used for more than athletes and coaches, and that's testing. Last April, the Federal Department of Health and Human Services allocated $315 million to North Carolina. There was money given to each state specifically for surveillance testing for COVID-19. And not just for athletes and coaches, for students and staff. And I urge you to revisit this as an additional measure to take in addition to masking and vaccines. The County of Los Angeles announced last week that their schools are ordering weekly virus tests for everyone vaccinated or not. And they say the evidence is mounting, this is according to a UCLA epidemiologist, evidence is mounting that vaccinated individuals can be part of transmission chains. Any testing regimen that does not include vaccinated individuals is going to be incomplete and leave people at risk. And I would urge you to consider that because the Delta virus is so much more contagious, to echo what the previous speaker said, the masks that children are using may not be sufficient with Delta for the students or the staff. I would urge you to invest in masks to give children and staff that will protect them better with higher filtration like the KF94, N95, or KN95. But in addition, we don't have to look as far as Los Angeles schools. We could look at Duke University. Duke University is requiring not only vaccination, not only masks, but also regular surveillance testing of staff and students on arrival and throughout the school year. And you know, with all due respect to the ABC Collaborative, they're working at a university that is protecting its community, not only its students who are residential, but every staff member with that level of knowledge. And earlier last year, I heard from you all that there may have been reasons not to test. Maybe that the antigen tests weren't as accurate. Now we have PCR tests. There are hundreds of millions of dollars at the state level waiting for districts to use it. There's been close to 50 districts that have already put testing into place, not just for athletes and coaches. I think Orange County could be a leader in modeling best practices for testing so that we actually know where the cases are, prevent them before they spread, and help our community, help our testing information go to the universities and the folks who are studying where the cases are. And I urge you to take this step to test beyond extracurriculars and beyond athletes, but for the sake of all of us, to test our students and our staff. Thank you.
Thank you. Our next speaker is
Jacqueline Barker.
Are you there?
Yes, can you hear me?
Yes, we can hear you. Your
Hello?
3 minutes. Hello, we can hear you, ma'am.
Okay.
Your 3 minutes starts now.
Resident of Orange County, I understand the importance of school culture, morale, inclusivity, and safety. However, each of these should never be put before an individual's physical and mental health or enforced at an individual's expense. I wish to send my child to a school that respects the inalienable rights of all of our students. By enforcing mask and testing policies on students, I believe this is a violation of the privacy and puts them at risk of prejudice and discrimination. I'm respectfully asking you to consider it not being enforced at our schools, instead having an optional masking policy for all students and staff, including outside at recess and sports, allowing our children to talk during lunch, and no testing on unvaccinated athletes, is giving every individual the right to make the choice that is best for them. Medical decisions belong to the rights of the parents and the individual, not the Board of Education. There are students, including my own child, that are unable to wear a face covering due to underlying health conditions or other exceptions. The wearing of one is causing more harm to their health than preventing a virus they are not at a severe risk of infection or dying from. As the summer is still here, wearing a mask in the heat and humidity while outdoors or indoors during recess and playing sports is putting students at risk of heat-related illnesses and injuries. In fact, the WHO has labeled it a health hazard to wear a mask while exercising and advises that people should not wear masks during vigorous physical activity. Will Orange County School be held liable for any heat-related illnesses, injuries, or deaths? How many of you will be wearing a mask for 6-7 hours a day, 5 days a week, as well as outdoors while exercising with no mask break when school starts back? That is what our children will be forced to do. These masks are causing more harm than benefit. Mask use and COVID tests are authorized for emergency use only, meaning they are investigational and experimental. By requiring a non-FDA approved mask or test, you're promoting the idea that masks can prevent or treat a disease. The EUA for surgical and cloth masks explicitly states the labeling must not state or imply that the mask is intended for antimicrobial or antiviral protection, or for the use such as an infection prevention or reduction. Most cloth and disposal masks do not claim to keep out viruses. Pick up any mask box or package, and you'll see a warning or disclaimer stating, does not protect user from infectious disease or illness, not FDA approved. We know that children have been reportedly shown not to be drivers of COVID. They have a statistically zero chance of dying from COVID. The CDC shows that like kindergarten through 12th grade mortality rate from COVID is 0.0003. How many children have died of COVID in our county? 0. And statewide, 3. Under North Carolina executive orders, face covering exceptions are outlined, in which proof of exception is not required and can be applied in school. My child will not consent to being forced to wear a mask indoors and especially outdoors. We'll be issuing an exception with the school if masking is mandated. I urge you to comply with federal and state law and advise students and staff they have a right to refuse or wear a mask and COVID testing. And any other course of action is contrary to the law. Thank you.
Thank you very much. Ms. Stowe, do we have another speaker?
Sarah Snipes.
Ms. Snipes, are you there?
Yes, I'm here.
Thank you. Your 3 minutes starts now.
All right, great. I would like to reiterate what Ms. Barker said and additionally add to it that the Orange County guidelines are swayed and slanted towards discrimination towards student athletes. In the current guidelines, why is discrimination against student athletes being even tolerated, correct? The approach does not convey an inclusive nor equitable learning environment. This mandate specifically discriminates against athletes and those who are unvaccinated and violates our parents' and our students' rights for freedom of choice. Currently, are the band and theater and agricultural or any other after-school clubs being held to the same vaccine and testing protocols? From what I've seen, they are not. It completely contradicts the school board policy to promote an inclusive and equitable learning environment. There is significant scientific uncertainty with regard to the vaccine and or its effectiveness on youth. There are countless examples of unforeseen, critical, and sometimes life-threatening side effects of some students who receive the vaccine. Additionally, I have a student who already experienced the COVID virus and only felt minimal effects for a few days. I will not require my child to take an unproven vaccine that could cause them uncertain side effects when they have already had actual proven real-life COVID antibodies. The current policies in place will now completely and utterly discriminate, specifically against student athletes and or any others that are unvaccinated for the sole reason of being unvaccinated. My third comment is, if the school district continues down this path against student athletes and those that are unvaccinated, how do they plan, well, including, and they would put those students under more difficult protocols and high stress processes during an already stressful period, correct? We're telling these kids that are unvaccinated, hey, you gotta do extra testing. And from what I heard from Dr. Benjamin, there's no difference in those kids that are unvaccinated versus vaccinated. They all have the same transmissions rates. Bottom line is, how do you guys anticipate handling public media and social media outrage over adhering all these discriminatory guidelines? And then how do you plan on handling the litigation and flood of lawsuits that come your direction?
Thank you.
Tell me the difference between the transmission of a trumpet player versus a soccer player. You're going to mandate that the soccer player wear a mask and be tested every week, but that the trumpet player not wear a mask? The policies don't make sense, and the science is unfounded. It's time for our
parents and students to wake up and remember they still live in a free country.
Thank you. Do we have another speaker? Ms. Stowe?
The last speaker is Daniela Tercio.
I cannot find anyone with that name in the WebEx meeting. Perhaps they're in person on site?
Oh, never thought about that.
No, she completed the online form to participate remotely, and she did not include a phone number.
Oh, well, we can't call her. Well, we thank you for all of the public comments. We will move forward because the night is growing old. All right, now we can have a discussion, board members. Who'd like to kick it off? There's much to say. All right, why not? All right, we're gonna start over there.
All right, so, you know, I do think it makes sense to have the indoor masking regardless of vaccination based on the rise in cases. But I do have concerns with the masking, especially looking at the CDC's recommendation about the mouth guards, as mentioned earlier, and the dangers of doing that while they're playing the sports. I think we need to have some consideration around how we treat some of the sports in those cases. And I am worried about, you know, how are they going to manage, you know, continuously saying, hey, yours isn't wet, you gotta change it, yours is wet, especially with the mouth guards and all that. So I would like to see what we can do about that.
Okay. Ms. Smiley?
I thought that we had delegated masking decisions to the superintendent, so I guess I was unclear in the presentation. I mean, are you looking for the school board to weigh in on that, or just explaining what your path will be? That would be helpful to understand.
So, my understanding was that was during the summer. I wasn't aware that authority extended
sort of
beyond the summer.
Yeah.
Oh, okay.
Yeah.
And I did make that recommendation too, because it's a new school year. And it's an area where I know that staff and the principals are constantly asked, why do I have to, who says?
Yep.
And so
And
just
school boards have been discussing
make
it.
sure there's very clear,
Yeah.
great clarity.
Because I did question that, because it said, we gave that authority to the superintendent, and then the attorney said, it's a new school year. I said, yeah, but it's the same pandemic. So, anyway.
I think my understanding is the administration is asking for you to give a stamp of approval, and then if you wanna delegate additional decision-making along the way.
Right.
That would be great.
And if I could also just mention, we do have Ms. Stewart on, so if you have any questions for her, she's still holding on part of our meeting. Just trying to acknowledge her presence.
Right. Okay, Sarah has another comment.
Well, so to this point about the masking, could we just clarify, I was unclear what the recommendation for the start of the school year is. Is it, because I think it had changed from the earlier version of the report that was on.
Do you want to bring clarity, please? Thank you.
Because I know we had talked about, there was something on the slide, but then you spoke, Ms. Travely, about some potential exceptions. Could you just explain?
Yeah,
what the
that's based on,
recommendation is?
you know, talking with the ABC Science Collaborative and just hearing where we are with the Delta variant. The recommendation was for universal masking indoors, but then also have universal masking outdoors, especially if we have students that are outside at the start of the school year for recess or other those in-school activities that may be taking place outdoors. The considerations, if any, we would recommend at the start of the school year until at least September 15th would be, if you're gonna have exceptions, would be for athletics where they have to wear a mouth guard, and putting a face mask on top of that may be difficult. We've also have looked at the same thing with the soil mask, how will we get those updated, replaced on the sideline, use of different filters in the mask that can be changed out as students are rotating in. And then to Dr. Benjamin's point, we did look at you know, having different protocol or procedures for different sports, but it does get difficult to regulate and communicate. Certainly it's an option, but felt it was best if we went with the universal masking indoors and outdoors, with the exceptions might be for, the athletic programs at this point in time. Again, we're not saying this is where we'll end. This is the beginning, and especially younger students as they learn processes and routines, recess, et cetera, the physical distancing, then there would be a requirement to wear masks.
A clarity question. But you also were recommending the testing as well for athletes.
Absolutely. The
So I
board
just wanted to
already,
clarify
yeah,
that.
we continued that because the board had already voted to approve the testing of athletes. Again, we didn't include, any of the other programs, band, extracurricular activities, et cetera. We're just not there yet. Those recommendations are in the last guidance that were just released and reviewed by July 30th. We will have to look at all of the recommendations and processes for all of those clubs, programs, or other activities. They would be masking. They would follow the masking requirement until we have, like this, a thought-out discussion and a plan on how we're going to approach the health and safety of those programs. And we're just not there yet.
Right. Carrie, you had a question.
Yeah, I guess, I also support the indoor masking and, regardless of vaccination status. And I have, I don't fully support the, universal masking outdoors for, particularly for vaccinated students. It just seems like vaccinated adults generally aren't feeling, advised to wear masks outside. And so I think it's kind of deflating for people who have, gotten vaccinated, that even outdoors they can't take their mask off. And even beyond vaccinated students, and I understand that there's kind of like you're trying to get things set up at the beginning of the year. So realizing that there's protocols, there's, to get in place, there's, tracking, how do you track which students are vaccinated. So I realize that there's a lot of administration that goes along with this. But like another, I'm open-minded about other students outside at recess, because I know at least last year, like middle school students, had to social distance on a track and wear a mask. So if you're social distance and you're outdoors, or if you're social distance and masked and vaccinated, at some point that's so many layers, it seems excessive. I have different thoughts about younger kids. One of our elementary principals mentioned that kids were able to kind of pod with their class, and so the teacher could, keep track of where those kids were outside, and so she wasn't seeing a problem, with parents who felt like those kids didn't have to be masked outside. I realize that might be harder. That might be harder to, we know that our elementary kids are vaccinated, and that's a lot of work to make sure they're socially distanced during recess. So I'm just saying I have a lot of questions about how long we have to do that, and when can we say, if you're vaccinated, you don't have to wear masks outside, or when our levels, when we're comfortable with our procedures, and those kinds of things. And then also just with some sports, I think of marching band. When those kids are out in formation on the field, it's hot, they're distanced, those masks are really awkward, uncomfortable. So I do want us to consider when is it safe to put in some exceptions, and those are some of the ones that come to mind.
Yeah, if I may, just offer some comments, and so I certainly appreciate what you just shared. I would, again, just state that, so the goal is to start at the highest or safest degree possible. We would continue to revisit and assess, and approximately around that September date, come back and take another look. We also have to keep in mind that we will have more students in school this fall than we've had since we closed for the pandemic. And so, and again, to your point around just the logistics of keeping up with, well, who's vaccinated and who's not. We can't give them a special mask, or armband, or to distinguish between them. There's just a lot to manage, and so we'd rather take the higher threshold of safety to begin with, reassess, see where we are. To Dr. Danny's point, we're all still learning, and information continues to evolve and change, and so that would be our comfort level, whether be on the safe and sorry side of this. And yes, there can certainly be some exceptions. We are looking at that with regards to athletics, as Mr. Aberle mentioned, with regards to athletes who have a mouthpiece. That's something we've discussed. We've discussed single tennis players. We've discussed cross country, much like we had in place last year. It was only when they were in close contact, they would pull up their mask, their gaiter, and but when they are much further apart, could remove it. So we are looking at that as well, but again, realizing we will have more children on campus, also just wanting to, again, with safety and health being a high priority, and wanting to keep schools open. That is the goal. We want to keep schools open, and we want to also ensure that our students have opportunity for athletics and not have to shut things down. And these decisions were made in collaboration with the Orange County Health Department and the ABC Science Collaborative.
Yes, we are.
So, I have similar thoughts to Ms. Dole on this, especially since, for example, HES is already doing this. So with the Plan B in 2 weeks, we would tell them, sorry, everybody needs to mask up now.
Yes, we would.
And we did this also for summer scholars. All of them did not require masks during, in the second session.
Right.
Yeah,
Well,
the
I
second
don't
session.
know that the Delta variant was where it is right now either. And so, again, the virus continues to evolve, and guidance that we had, as was shared, and maybe Ms. Stewart, you want to speak to this, the guidance has changed.
Right.
And so what we were told 3 weeks ago has changed. And so we continue to evolve and pivot with the virus. That's what we have to do to keep our students and staff safe. Ms. Stewart, did you have anything you wanted to speak to on this matter?
Yeah, thank you. And I hear the comments and I agree. The one thing I would just echo that Dr. Felder just shared, you're right, the Delta variant has really been a game changer. I think it's reasonable to be more cautious in the beginning as kids maybe have traveled and been out of state or visited with family and friends over the summer break, to be more cautious as they come back. I say the one thing to remember, when we have cases, the Strong School Kit made a change and they gave an exemption about quarantine. So again, with the goal being as much in-person instruction time, if we have some cases that occur, early on in the school year, and we can demonstrate that if the students were in close contact, that's 3 to 6 feet for longer than 15 minutes, if they are wearing the mask consistently, covering both mouth and nose, then they don't have to sit out and do that quarantine time. So, I mean, that is one of the reasons why I would support the masking outdoors early on. The other thing is, whenever you reassess mid-September, maybe our transmission rate for the community will be lower, but right now we are in high transmission rate. Again, 233 new cases just over the last 7 days. That's a lot. And we haven't seen those numbers since last winter, January, February. So,
Thank you. I mean, that's really high. So Will and
Right.
Sarah. Okay, Sarah.
Yeah, I mean,
Brenda?
oh, no, go ahead.
Yes, Bonnie, yes.
Yeah, I just wanted to throw in my 2 cents. I first want to just echo Dr. Felder and Ms. Stewart's comments that, having our kids back in school is our #1 priority. And for the first time in a long time, we're going to have them all back. And we're going to have them all back at the same time. So there's nothing that's more important than the thought of closing schools or kind of pivoting to a Plan B or something just makes me shudder. So getting our kids back and getting them back safely is our number one priority. And I will just compliment, I think as a district, we've done really well in terms of keeping our kids safe. And so we have to honor that. I'm not so happy about outdoor masking, masking during recess, but I'm willing, and I've been kind of asking parents during this, I'm willing to go with it for another month or two. Let's see how this plays out, but I'd rather be safe than sorry. But I'd like us to look at some flexibility around sports. So that's kind of where I am on it, but I just I want our kids in school, and I want to be focused on learning, not on whether or not we're masking them.
I was just gonna say that I basically agree with that. I think starting with more restrictions and then loosening them, I do think there are just some sports that it seems to me logically, if they're far apart the vast majority of the time, like tennis or cross country, maybe I'm open to exceptions to that. I spoke with a TA recently who would be in charge of sort of monitoring the children at recess, and she said it's a lot. Like if they're not masked, like I'm gonna need to make sure that they're a certain distance apart, and like with that many children, like I don't think I can do that. And so I do hope that we can move in a direction where that's possible, but I certainly understand why we would start out with some masking, especially for the unvaccinated. So.
Did you have another comment?
Yeah, the only other comment I wanted to say is, when we started down the path of going back to school, we talked about establishing metrics of where the thresholds were. And I would just hope that when we get to September, we would have, what those thresholds would be, right? Is it going to be less than so many cases, infection rates? I just want to make sure we're doing something that when we come back in September, we have something we can say, hey, yes, we're better than we were back in August. This is a positive direction, and we're going to consider it less than feelings, right? I'd like just some numbers that we would feel comfortable with. I know in the past, the health department has worked with us on what they felt comfortable with. So hopefully we could get to some measurement of some sort. Does that make sense?
Yes, I hear what you're saying, and yes, that's where we started. And while we continue to take community metrics into consideration, we also look within, and we're looking at and using as a gauge the clusters as a factor that we would consider. So it still remains a combination of both, certainly taking the community metrics into consideration, but really looking within at our individual schools and facilities and what's happening there.
Okay, all right. Well, it sounds as if that we as a board will give stamp of approval for the superintendent's recommendation for starting school. And it's important to us to have our children back in class in person. But if trends change, we will revisit this in September, as Dr. Felder and Mr. Aberley said. Okay, Sarah, I'm going to finish. I haven't had a chance to speak. And I want to say that the safety of our students and staff, because we keep saying students, but our staff's very important as well, because they can't be here without the staff. So the safety of our students and staff is very important to us, and so we will come back, revisit this in September and see where we stand. But right now, we are going to support your recommendation that you put up on the guidelines. Sarah, you have something else to add?
Well, were we going to move on to the next item? Because I think I had some additional questions about this item.
Well, two things.
This
I think,
attorney.
one, I heard some question from staff about the sports testing, and I want to address that. And then two, I think ideally there might be a motion to approve the I mean, again, I know you have delegated in the past, but I do think it would be good to have official action.
Right, and that is on here. It is-
Okay.
we're
It is next
gonna-
as an action
right,
item.
it's on
Okay.
here as action. I was gonna wrap up everybody's comments.
Okay.
And then, because I didn't wanna put a motion, have an
Yeah.
action, and then somebody else wanna continue to make comments. Although,
Mrs. Stevens,
Yes,
can I just
ma'am.
insert one other item? I'm sure you all know this is a given. Of course, we'll come back sooner.
right,
If, situations
Right,
change
right.
and not wait until
September.
Yeah.
Truly, truly.
Just
That
know
was
that.
just, but you have to have a gauge.
Sure.
You have to have something, and I understand that you all September is something to work with. All right,
So the one area of clarity that I heard was, the plan as it stood for sports testing was weekly testing for those who are unvaccinated. And if you are not willing to undergo weekly testing and you're not willing to show proof of vaccination, then you would not play sports this season. And I heard, Mr. I just wanted to make sure that was still the board's understanding.
That's correct. That's where I needed clarity, was
Right.
if they would be required to wear a mask or they would not participate in athletics, and so we needed to be,
Yeah.
wanted to make sure we were clear in what we're.
Cause it sounds like everyone's gonna have to wear a mask anyway, probably, or most players.
Except for, the exception would be the mouth guards.
Right.
Mhm.
And it sounded like the board was allowing us to do an exception for these individual sports where a student may be the only individual on the field of play,
Mhm.
such
Right.
as a tennis player or a cross-country runner.
Mhm.
There's no one near them that you would agree to an exception for those as well.
And-
Football is going to be the biggest one because of the mouth guards and because of the other equipment they wear, that keeping on mask inside a helmet is very difficult. As soon as your head moves, the mask is gonna come off your ears.
I just wanted a little clarity, so I heard Eva say that if you're not vaccinated, you have to test weekly, but then are you also saying or always mask? I'm confused.
So, no, because if they don't test or get vaccinated, they wouldn't be playing sports.
That was the original
Right.
policy,
Okay,
so I
that's
think,
that's what I thought.
Yes, that's the option, is either they do the COVID testing.
Mhm.
We say weekly in our documents, we heard the recommendation tonight is twice a week.
Mhm.
If the state program supports twice a week, we will go with twice a week testing. So I just wanted to rule out any confusion. We'll test as much as we're able to. If we're able to do the twice a week per the recommendations, that's what we will do. So if not, it will be a weekly test. If you don't test, because either you don't give permission or you refuse to take the test, then you would be excluded from participating in sports.
Will, you had a question?
Yeah, the clarity is, the way it reads is that's true for staff too.
So the coaches is the other one. I'll let Eva do more of a legal guidance on employees, but coaches are employees of the district. And so we can be more restrictive in what we require, including any vaccinations.
so yes, you can require coaches to, undergo the testing protocol as well. Or I guess the rule would be, under your current policy would be, unless they show proof of vaccination. And now, the proposal is that all employees be asked to show their vaccine proof if they have it, so that you can track. And I know there's been some question about whether you can ask people that question. The answer is yes, you can ask them. And you would maintain those records confidentially the way you do. I mean, all teachers have to provide a health certificate and certain vaccine information when they get hired, and you maintain
Mhm.
those. And same for students, we're already maintaining confidential vaccine records on all our students, so this would be maintained the same way. So in the answer to that question of whether you can ask people if they're vaccinated, the answer is yes. And as far as requiring testing, that's also lawful. I know there's been some questions about fairness or whatever with regard to requiring testing of athletes, but there's logical reasons for differentiating between athletes and other populations, and athletics are a voluntary, optional activity that already, that you set many conditions for participation. Athletes have to bring in a physical every year. Other students don't have to do that. Athletes have to maintain a GPA, they have to maintain certain attendance, you know, that's all part of the deal, so. I do not have any concerns about that from a legal perspective.
Thank you.
All right. Are we all clear? Sarah's got another question.
Well, no,
No, okay,
it
that's
wasn't,
fine.
it wasn't about that, well, it, you know, it was about other pieces of it, so I wanted to
Okay.
make sure we were done with this athletics testing piece.
Okay, okay.
Are we clear on that? So if you don't,
Uh-huh.
don't test, then you don't play? Okay.
Uh-huh.
My question is around testing and either requiring staff to be vaccinated or to do regular testing. I believe that it's possible to also apply to the state for that, and I know, I just think Delta has changed things and the amount of transmission, and so I would, just wanted to put it out there, I would be in favor of that. I don't know if it's something you all have discussed, but I would certainly.
We are discussing that, yes.
Okay, and so I know that there's a window to apply to the state for the.
We've applied.
Okay, wonderful, okay. And so when do we expect to hear more about that?
Hopefully
This week?
Okay,
Mhm.
and so, will you need additional, like, board approval, for anything there?
I don't think we do.
No?
You don't need board, if you've applied,
Yes.
I don't think we have to approve. I didn't hear
Okay.
that at the meeting.
Eva? I'm
So
sorry,
the
do the
question is, if the administration is able to begin testing of employees, do they need board approval to
Uh-huh.
do that? I suppose not. If the board is all in favor of it, I always love you to go ahead and make that clear to the community, but,
Yeah.
you know.
Yeah. I'm fine with it.
Yeah.
Cause, you know, safety first. You know, we're doing it to be safe.
So,
You don't have a
just for
question.
clarity, it would be testing for people that are unvaccinated.
For
not-
staff members.
Right.
Staff members.
I'm looking to you, I don't know.
Yeah, I just wanted clarity. You're
I'm
not
good.
saying everybody's being tested, it's people that haven't been vaccinated.
So at this point, what we're talking about with athletes and what we're talking about employees would be unvaccinated individuals.
Right.
Okay.
We've not brought a proposal forward with what you heard tonight about surveillance testing, where we have spring break, we're gonna test everybody when they come back, or winter break. Hillsborough goes on intercession, we test everybody. We're not there yet, that certainly is an option that school districts and that we could use. We're just not there yet with being able to bring a recommendation, although that is, we're starting to see more and more of that in the guidance. And how to do that is a little more complicated, but that would be certainly a consideration and an avenue for us to approach, would be, understand the scope and bring back details on how we might accomplish such a task. But I don't think today, one, we're either prepared, or, ready to do that, and especially we can't, or don't have the means to do that, locally. We need that state grant, the program to assist us to accomplish this task.
Mhm.
So unvaccinated staff, we have to test. Is that what I'm understanding you said?
Yes.
Oh, that's my question.
Mhm.
Thank you.
Do we have any additional questions?
Raising her hand.
Just one final
That's right, you
question.
could say.
Hillsborough Elementary, when would this be effective for them? When would the new guidelines be
Less
effective for
clear.
them?
Effective immediately,
Okay,
as soon
okay,
as we can get notice out, so.
great.
Yeah.
Great. Yes, Sarah?
I'm sorry, I know we have a
Thank you.
bunch of other, my concern is, non-compliance with masking. So I have heard in the past couple of weeks, I've heard about incidents, from last school year, over the summer and this school year where, certain staff members or teachers have taken mask breaks, in rooms with students. And so I just like, how are we, you know, Dr. Benjamin last year said, like, these outbreaks in other school systems were because people got lax.
Mm-hmm.
So I am concerned about people getting lax about masking, how far we are in this pandemic. So how are we gonna be on top of that? And how are we gonna communicate that to, you know, the folks I spoke to? I don't know that they reported it in any, I think there's a Google form or a hotline or something, but I don't think anybody reported anything.
Yeah, thank you, Mrs. Smiley, for that question. So the plan is to sort of reboot what we did last year with regards to making all staff, students, family, and community members aware of the anonymous reporting means. So we have an email and a phone number that one can call to make those reports, as well as if one wanted to report it to the administrator on site, that's certainly a way to do that. So there's a way to do that anonymously and directly. So we will certainly ensure that. And we are working around and planning around mask monitoring. So that was a process that we put in place where central office staff supported school-based administrators and or their designees around monitoring for masking in schools. Because you're absolutely correct. We tend to get comfortable, and we had very good data last year, but we know we're dealing with a very different variant. And again, safety is the highest priority, so we will continue to message to our school administrators, our department administrators, because this is not just a school issue. To Mrs. Stevens' point, it's about staff, and we have staff in places besides schools, and we want everyone to be safe. And so we were very, very serious about the need to remain vigilant with regards to masking and put systems in place to support that around with the expectation that administrators and or their designees are monitoring. And I can tell you, as I visited schools last year, I saw administrators walking around collecting data on masking. So we are planning to continue that effort this year. Last year, the board so graciously afforded us the opportunity to hire folks to take on that role, but unfortunately, we didn't find any takers, so central office staff took that on. And we popped in on schools and facilities unannounced and have a protocol that we use for collecting those data and giving feedback to schools on that. So, and we're certainly going to explore other ideas. I know that in another school districts, the staff actually took that on. There were some staff who were interested, and on their breaks and such, they were participated in their individual sites with mask monitoring. So it is critical. No sense having an expectation and it's not going to be monitored to ensure that it's done with fidelity. This is one of those, it must be done with fidelity, it's not going to work. The mask on the chin does nothing.
No.
On the forehead, it's not going to help at all. And we also recognize that we were able to dial back. And so we've got to get back into the habit of being very, very diligent around masking.
All right, so this has been a very important subject matter, of course, but now we're going to move down to the action portion of it, because it's an action item. And you know, it'll be really difficult for a board member to articulate everything precisely. So we have it here, if we could use this as the basis, like to provide updated recommendations for safety guidelines and expectations for the start of the school year, because it's all written here, but we do need to have a motion and take action on it. So, because we've said that we are giving Superintendent Felder a stamp of approval, but we need to take action tonight.
Yes, ma'am.
So if someone would like to put the motion on the floor, and then we can move forward.
I will attempt.
Do it.
So, motion to approve recommendations from the superintendent for the start of the school year, including the exceptions discussed in specific sports.
That's right.
Do you want me to list out the sports?
No, we don't. We don't, because, all right, and thank you. We thank you for the motion, Mr. Atherton, and thank you for the second, Ms. Doyle. Do we have any further discussion?
Can I make a friendly amendment? And that's to be revisited no later than the end of September?
I think, yeah, okay, I
See,
think we said, yeah, I think we said that in our discussion that it would be revisited.
I'm okay with that.
Yeah, so he's okay with that,
Ms. Doyle, are you okay with that?
and she's okay with that, all right.
I'm sorry, Madam Chair, did we want to include the staffing?
Why don't we address that separate?
Okay.
Okay, all right, so,
I'll-
Just in the language on the agenda, it actually says September 15th.
right.
So I'm fine with end of September, but it actually did have a
Right.
date in there.
Right, it did, and that's why I said go from what we
Okay.
have here.
Yeah.
It'd be less
That's fine.
confusing.
Then leave it, leave it.
All right, yeah, because it'd be less confusing for people who are tuning in,
Yeah.
who's reading it, we want to be clear. All right, so it's been motioned, it's been seconded, and we've completed our discussion. So we'll start the vote with you, Ms. Hauser.
Yes.
Thank you. Mr. Atherton,
Yes.
Ms. Smiley,
Yes.
Ms. Doyle,
Yes,
Dr. Moore,
yes.
and I say yes. Thank you so much. The motion passes.
Thank you
It was a
all.
very hearty, lengthy item, but it was well worth it.
Thank
Well
you.
worth it.
Mr. Atherton, did you want to move to authorize the administration to pursue testing for staff? If,
I wanted to at least have a discussion before doing that, since it's not an agenda item, but I'm a little concerned with not having a broader discussion. I think it's a good idea, but I personally would like to get more input, but that's just how I feel.
Okay.
And it's not on the agenda.
All right,
so
yeah,
that's
it's
my
not on the
concern.
agenda, so let's not go down that road right now.
Exactly, that's
Okay?
why.
Let's
that's my
not do
concern.
that. All right, so the next item that's on the agenda, whoop, there he is. Facilities updates. You have,
That was once again B, Mr.
Mr.
Everly.
Everly, you have 15 minutes or less.
Sorry, yes. Yes, sorry, I realized I had the clicker over there. so.
That's right.
We do have Nick Mixie, the Director for Facilities and Capital Projects, and I believe Roger Ivy, our Director of Maintenance and Facilities, online as well. Wanted to bring you an update to several projects this summer. Specifically, as noted on your screen, was the renaming of Cameron Park Elementary to River Park Elementary and Stanford Middle School to Orange Middle School. And wanted to just say that, you know, following board action, staff in the schools and all of their input partners went to work quickly to get things ready for this school year. That was our goal. And so at River Park Elementary, all painted items, with the previous name in the building have been updated. It's all, there's some areas in the school, obviously there'll be some continued work for like some new murals or artwork to be put up, but we have gone in and helped them assist with removing some old namings. Floor mats and things with the old previous logos have been placed in storage. We will update the board to the process for surplus or individuals that may want those following our board policies. The temporary marquee signs have been installed, and the permanent signs we expect to be in by January. The serving line in the cafeteria has been updated with the new name. Flooring in the lobby with the old initials has been removed. New tile installed. And there's a dedication plaque with the mascot in the hallway, and that's been updated, ready for the new name. And the mascot and school colors did not change at that school. For Orange Middle School, we did review the entire campus. For anything that was associated with the old name, the colors, and the mascot. The school team reviewed and updated the school colors. They did, as you see on the screen, they do now have silver accents, and they do have a new mascot logo as well. The main marquee at the road is being updated and will be completed by August 16th. The orange paint highlights will be started the week of August 9th, because if you were on the campus before, you will see it was primarily blue everywhere. So there's still some blue that will be retained, but you will start to see orange and silver appearing very soon. The auditorium, there's a medallion within the brick veneer. For those of you on the Building and Grounds Committee, you know there's a little more that we have to do to get that replaced, and we'll be actually covering that with the project. And then the scoreboards, we're reviewing those and hope to have those updated by October 1st. And the contractor's been in looking at the gym floor. They need about 7 days to complete that work. And so we weren't able to get them on the schedule to get that completed before school starts. But we do promise the staff and the community, we will have that gym floor redone over the holiday break in December. And then, as I said, the new accents and the colors are being added. I did want to just give the board an update. There are 2 original dedication plaques within each facility. Those list the names of the Board of Education members, the names of the schools, certain other pertinent information when a building is dedicated and first brought online. There's a permanent plaque that's installed in those facilities. Our recommendation is that the plaques remain. They're part of the original dedication of the buildings, and we would recommend that we add a new dedication plaque next to those that says the school has been renamed with its new name and dedicated by the Board of Education, put a date. So we have the old plaque that remains and a new plaque that's added to that. So I did want to give you an update on that. Yes, ma'am.
Just a quick question, is the Orange Middle School still the is that a Charger, the horse, or is it of a different name?
So I will say they're working on that. The
Okay.
last I heard, I'm sorry, I don't know.
That's okay.
Because this is a recent addition to the slide.
I heard they were saying the Chargers.
They are the Chargers.
Yeah, they are
Okay,
the
they're keeping the
Chargers.
Chargers,
Yes.
but now
They're the
that is
Chargers.
the Charger.
I like that.
Thank you.
I like
Thank
the-
you to staff for helping me with that.
I like the Charger horse.
And they let families vote on a couple of different
Yes.
logos, which was nice, so my daughter had an opinion.
And then, in the sake of time, we have a large number of facility projects that's mentioned within the abstract. Some of those you see on your screen. I will say, maintenance has been quite busy, 802 work orders completed this summer. I do want to mention some facility work that does tie into our last discussion. What things are we, in addition to major facility work, are we doing in preparation to keep students and staff healthy this summer, but leading into the opening of schools for the fall. And of course, these things were done at Hillsborough Elementary School prior to them opening. We've done major filter changes on all of the HVAC systems. You recall last year we upgraded filter media as well. Roof ventilation units at Central and Orange High School were upgraded. And again, part of that is increase in circulation within the building. Safety inspections have been done on all fire alarms, backflow prevention devices, which deals with plumbing. Water testing completed in all schools, and also indoor air quality assessments. They installed bottle filler stations per school, so we will be asking students not to put their mouth on water fountains, to continue use, which was the best practice last year, of bringing water bottles or filling their water bottles at school. But those filling stations are now at all locations. And then there was this ionization units that are in the HVAC ductwork were installed in all the secondary music classrooms and band rooms. In elementary schools, those music rooms will be installed later this fall. And then we're also looking at media centers or other large areas. The advantage to the ionizer being in the HVAC unit is like tonight, you heard the background noise you were getting from the portable machine in here. When it's passive in the HVAC system, it's done its work to sanitize the air, but you're not hearing it. So especially if you're having children trying to sing or trying to perform and you've got machines running that definitely disrupt that. Because in those areas, they're not using the small sizes for a typical classroom that's 1,000 or 800 square feet. Those spaces are larger, so therefore any portable machines have to be much greater with the higher air volume circulating, and so they get quite noisy. And so we'll continue to work on those. And then you can see with several of the schools, some of the other major projects, but unless you have questions, I'm not going to go through the information that's presented.
Okay, all right. Do you all have any questions over there?
Go ahead.
I have,
Okay, go on, Bonnie.
yeah, just a couple of questions. First on the renaming, do you have an idea on uniforms? Because I'm getting complaints from parents about the uniforms not being available, and I wonder if you have a date on that.
Did you want to?
Yeah, come on.
Good morning, Vice Chair. Good afternoon, evening, Vice Chair, members of the board. The school is working on securing uniforms now. They have to get a couple of bids in order to refurbish all of their uniforms. They're working on that feverishly and have had one bid returned to us, but they're waiting for a second at least, and we have to have that for North Carolina purchasing guidelines. But they should have that pretty soon, and we'll be able to initiate the order as a result.
All right.
Thank you, Dr.
Thank you.
Thank
Mine,
you.
that was
And
Doc-
then
that was Dr.
second
Nora.
question
Okay,
is,
another question.
do we, we originally we're working with an estimate of about $200,000 to get this all done. Is that number looking good, or, any sense about that?
I don't at this point in time. I can, we'll work with the finance officer. We can provide the board an update, but I do not have an update on
Yeah.
cost today. But we can,
Okay,
we'll
great.
make sure we provide the board an update.
And, okay, thank you.
Okay, Sarah?
On the ventilation front, glad to see these investments. Are schools expected to use the HEPA air purifiers that we provided last
Yes.
year?
Yes.
And that will be a piece of us monitoring compliance?
Yes.
Yes.
Okay,
And
wonderful.
we'll also provide additional written guidance to staff. My understanding, as we're going through preparing our local toolkit for schools, we need to help educate staff, especially if they're new staff, about the machines, how the machines work, how best to use the machines, and the expectation for running the machines. And I've had several questions the last week about filter changes, et cetera, so I want to update staff on that as well.
Excellent, wonderful, thank you.
All right, thank you. We all had a question.
Yes, so, we had talked about HES and the condition of their HVACs, and I was curious to know where we are with that, because, we were concerned with air quality and then the long term of the facility, but I'm just curious about the AC condition at this point.
Yes, good question, because historically, we know, we always have an HVAC system issue in July when the school opens up, because that's when we have the heat and when the systems are running, higher than normal. One is, the facility staff and Roger Dick, they have additional details, have already replaced one chiller on the campus. A second chiller, there's three chillers, the second chiller needed some repairs, immediate repairs. We've authorized that work to be commenced. And the third chiller, was not far behind second chiller, and it could go out at any point in time. So we went ahead and authorized while they're there, updating chiller 2, we go ahead and get chiller 3 updated. That'll extend the life of all the units. So that helps us keep the airflow and things moving. We're doing all the other processes we're talking about, the other campuses with the air purification systems, making sure we've got proper ventilation, and anything else that we can do to assist. But having the HVAC systems running is always necessary and a concern. But with COVID, what we did starting last year, I'm sure we did here as we did across the state, we updated our building automation controls. We ran things 24/7 or in full occupancy mode prior to students coming into the building, after folks leave. So systems really never got a break. And we know that school had some old mechanical systems, so therefore we're doing the necessary repairs now to head off any critical issues. And then as we talk about our long-range facility plans, when I come back August 23rd, we'll talk about those mechanical systems that are in process and those that still need additional work, like Hillsborough. Did I answer your question?
You did, you did. I do have one other, if I may. The River Park, there was a lot of abatement that was being done. Was all that completed?
It was. So, two large projects there. We've broken those down into phases. Phase 1 included mechanical systems, lighting upgrades, painting, floor work that was done in the school. We've moved into phase 2, and there's going to be additional work on that, and we'll give you an update on the 23rd in reference to that. But most of the what we have in older schools, we do have hazardous material. It's all encapsulated or sealed or in a condition, and we do 6-month monitoring. We also do a 3-year plan on all of our hazardous materials, and we do continually independent individuals coming through. And then anytime maintenance or work's done in the buildings, they have to certify. So I just want to inform that when we do this type of work, we don't do it lightly. We do it with trained individuals who specialize in these projects and when we do renovations. But I don't want the public to be concerned that their kids are in a school that has hazardous material or asbestos or something else, because older facilities, there's always the potential. We know where it is. We have the proper protocol and procedures in place. And then when we renovate, we make sure we do it. And that's one hard, difficult thing about older schools, is we just can't go in and do some of this renovation when schools are in session. And so you hear us talk about, that's one of our issues with trying to get these older facilities brought up to speed, is because of that. So that,
Yes, thank you.
All right, thank you. Thank you very much, Mr. Aberly, for that speedy presentation. And now we have student achievement is next. It was 35 minutes allotted for it. If you could do that in 15.
Absolutely. Good evening, Vice Chair Stevens, board members, Dr. Felden, and families. So yes, I will do that as quickly as possible. We're here tonight first to give you an update on our Summer Scholars Academy.
Oh, yeah.
As you know, we just finished our first inaugural Summer Scholars Academy. Last spring, as we know, House Bill 82 required a summer learning choice for NC families. And Orange County Schools, we brought together a dedicated team of leadership of OCS, and we created some innovative programming for our summer program. We put under one umbrella previous summer programs and then added to that. And as the chart shows, that we had all types of staff, including our teachers, TAs, we had college and high school interns, counselors, social workers, nurses, bus drivers, we had the full district support rallying around this to provide all of our students full service. And we're servicing over 1,495 students. And we, of course, provided in the morning a focus on academics, where our students who needed personalized learning based on remediation and readiness, they were provided those supports, especially in literacy, mathematics, and the sciences. And then all of our students, regardless of where they were academically, received enrichment programs in the afternoon. And as you can see, some of our programs that we offered were Sam's Lab, our Museum of Science Engineering program, Smart Girls, which was a STEM focus for all of our students and not just our girls, Legos, media literacy, design, Nuvu, which was a very different way of solving problems, Notes for Notes allowed students to make music. And some of our highlights we would like to also include that, you know, our rising 9th graders, they had an opportunity to visit their high schools and to get an early peek. They also visited colleges, and we even had our high school students visit colleges and industry partners to look at what types of internships and apprenticeship opportunities there were. And we even had a group of our students take a Swift coding class on the DTCC campus with the college professor. But I think one of the things that we're most proud of is that 18 of our high school students, that with this opportunity were able to make credits and receive their diplomas this summer. So congratulations to our 18 students for working hard, persevering, and proving to themselves that when they can't try, they can, and they did. And so I just want to note that, you know, the focus was to bring joy back to learning, and evidenced by our students, we were able to do that. And so I'm just going to, you know, our site administrators, they did a great job of providing weekly updates to our staff and our families, and we got feedback. And at the district level, we also reached out to our families, students, and parents for feedback. This is some of the feedback that they gave us. I think, you know, you can see the ones from our young students. Some of the concerns, you know, that the nerves were around that they were going to schools that they hadn't been to before. teachers that they hadn't had before. And what ended up happening was that they really actually liked that opportunity to meet new friends, to have different teachers. And teachers felt the same way. It was nice to be able to interact with new colleagues that they normally don't get to, and also engage with students from across the district. Also on July 21st, we had an open house, and thank you to many of you that attended. And we also had the state liaison with us. And you heard Ms. Payton share that over the 13 districts that she supervised, she had already visited 6 of them. And Orange County Schools was offering the summer programming in ways that they were not seeing in other districts, and we're very proud of that. But I think, you know, like one thing that when you look at what the teacher is saying, we too have teachers that kind of were hesitant at the beginning of all of this, but once they experienced the professional learning and then actually got to teach new curricula that they weren't used to, and with students that were showing to them when we hold our expectations high, that we all rise to the challenge. And they were really excited that they pushed themselves as adults, learners, and experienced success. And so, you know, I think a parent too, just really appreciative of the opportunity for their children to have this learning experience. And so we just wanted to share another quote with you. And I think, and I'm trying to wrap it up. So, as we know, you know, this was hard work, and we had to do a lot of heavy lifting in a short amount of time. And not everything was perfect, but we were able to adjust quickly. And the one thing that we can say is that while adults might have been experiencing some shifts, it was very minimal for our children. So that's always the most important. So we've already started planning for next year. Where, you know, we have some best practices that we want to keep, but we also have some lessons that we've learned. We obviously will have an opportunity this year to start planning much earlier than last year. And, you know, when you start earlier, we'll have an opportunity to include more stakeholders, be able to hire sooner. That allows for more training for our staff. And, you know, there were a lot of positives of integrating the both remediation and enrichment, because all of our students, regardless of where we might have different skill gaps, deserve opportunities at enrichment. And when you saw our EL, our EC, our AIG students all in the same room, being able to interact and learn from each other, is powerful learning going on. We know that we had some payroll challenges just because we were trying to cover all of the different shifts that this summer program created. And so as we minimize that next year, we will be returning to a stipend model that will decrease any payroll issues. And then there were lots of benefits with college and high school interns for the young scholars to see not too much older people in the classrooms modeling for them, because, you know, as oldies, it's not the same. So, you know, that's the best practice that we would like to continue. And then, of course, you know, it's really beneficial for our families to have the before and after school care that allowed for more families. And when we're talking about equitable access, we have to go above and beyond to provide those opportunities. And then, of course, one thing that we were able to do this year, again, was to include the wraparound services with the social workers and the nurses, because we were being very mindful of the social and emotional well-being of all of our students. So those are some best practices that we will continue as we continue to learn from lessons. And before I end here, I do want to just acknowledge our curriculum and instruction team, especially Dr. Gannon, Ms. Krim, and Ms. Wilson, because they have worked extremely long hours and very hard. But I have to say that on behalf of all of Orange County School staff, they worked really hard to make this happen, and I'm very proud of what they've accomplished. And I just want to thank them and just acknowledge them publicly for that. And of course for the support of, you know, our superintendent and her leadership, and all of you, because you gave us some grace when we needed it. So on behalf of the district, we just want to thank you so much for all your support.
Thank you. Thank you so much.
If there aren't any questions.
All right.
Of course. I'm so sorry, I do have one.
Oh, I'm sorry, but one other thing, I had my notes written, but I was trying to.
Okay.
So I didn't read my notes. But, so, you know, of course, there were pre and post assessments. They were all done, but now we're just waiting from the state to get the results back. As soon as we get that, of course, we'll share that with you. Bonus pay, teachers are getting their bonus pay because we know that nationally board certified teachers, as well as those who previously received the bonus, will be getting their bonus. And then, based on how our students perform, they will also get a bonus based on performance. And that's all based on House Bill 82 guidelines.
that was my question, was about the academic progress. And then I would, when you give us that data, I would also love to know, it looks like we had more than 20% of district students participating in summer scholars, which is excellent.
That's great.
And understanding how many of those students were the students that were sort of far behind, that like really needed the sort of academic piece of it, and understanding that in that data would be helpful too. Thank you very much.
And your question was similar, wasn't
It
it?
was.
It was.
Yeah, it was similar. The only other thing I was gonna say is, I just wanted to acknowledge, the hard work of also the transportation department and all the challenges they had between session 1 and the different people in session 2. And many parents reached out to share, how fantastic it was, that it was at the end of the day where they didn't have to come pick up a child or pick between that. And I just want to acknowledge them because they did a fantastic job, juggling all of that.
Right. Thank you for that, because oftentimes they don't get the knowledge.
That's right.
Thank you for that, the child nutrition staff that they also.
Absolutely.
Thank you very much. And if there aren't any other questions, I would like to introduce to you our new Chief of Schools and Student Achievement, who'd like to present our next agenda item.
Okay.
Dr. Cole.
Actually, are you not up for the unfinished
Oh, I am.
accelerated
I was
learning?
trying to be on.
I was trying to you can come in, Dr. Doyle.
I was trying to skip super fast. I'm like, okay.
All right, well, go ahead, you have about 5 minutes, right?
Right, that's right. Because we ended 9:30.
This should be quick. So this one I will read to make sure I cover all points. So as we prepped our students during summer scholars, right, we would also like to share with you how the district will be continuing to address our unfinished learning from last year while accelerating our student learning. So through the multi-tier student support system, we will focus on the 3 tenets of the instructional core: rigorous, culturally and linguistically relevant content taught by our qualified teachers who are culturally aware and responsive to the needs of our students, in such a way that our students will have greater access to an excellent education. We will do this by aligning our school improvement goals with a focus on incremental and sustained growth in student performance guided by data analysis. Through diagnostic assessments to determine both the academic and social emotional needs of our students, we will monitor the learning progression and adjust our teaching to provide new learning experiences that are supported by research. We will focus on grade level standards and scaffold up to address the skill gaps instead of so often we tend to scaffold down or bring it down. And we will also analyze both quantitative and qualitative data to know what shifts need to be made. And we will engage our families as they are the most valuable source of data about their own children.
That's right.
And we will also, here, to be student-centered, we must be teacher-focused. So research tells us teachers have the greatest impact on student learning, and therefore, the district will provide strategic support and professional development in research-proven best practices, and this will include job-embedded coaching to build the capacity of our teachers, coaches, and administrators. We will revitalize our professional learning communities with a focus on improving student learning. We will relaunch our social and emotional supports, such as the Code of Conduct and Restorative Practices. And we will, include professional learning in the science of reading. And we will collaborate through instructional rounds focused on data-driven problems of practice. In addition, the district will provide supplemental supports to include high-impact tutoring, our K through 12 math coaches, instructional leadership training for our principals, and of course, our grant funding to support school-level innovation. This work will not be easy, nor will it be cheap, but as it has been said, district budgets reflect the district's values. As it will be shared a little later in the presentation, much of our ESSER budget is dedicated to supporting the unfinished and accelerating learning. I just wanted to share that with you this evening.
Thank you. Do you have?
I just have one comment.
Okay.
I'd definitely like us in a future meeting to deep dive in this.
Yeah.
I would like a lot more detail on this. I appreciate us getting the preview.
And we're finalizing those plans in which we will be able to do that, but we just wanted to give you high-level overview of some of the work that we're looking to address to be able to do that. But we still have a little bit more tweaking to do before we bring it back.
Excellent. Thank you.
Thank you.
So just,
What is that timetable? I was just curious when we might see really specific plans and resource
classes and stuff like, and the things that our schools really need.
So I'm hoping at the next
I know.
meeting.
Did you hear that, Bonnie?
I didn't hear that. I'm
So
sorry, say
plans are
that
still
again?
unfolding and coming together, Ms. Hauser. Thank you, first of all, for your question. We anticipate by the next meeting to be able to provide a more detailed update. And then beyond that, we will just continue to add layers as needed. Yeah.
And we
Okay,
did-
thank you.
Yeah,
You're
part of
welcome.
that is why we have the 2 contracts on the consent agenda, because that's related to the work.
Right.
So once we know that those are approved,
And we're
then
gonna
we
get
can
to that.
detail those plans.
Right after Dr. Doyle, we're gonna get to that, okay?
All right, thank you, Dr.
Thank you.
All right, so
Thank you,
next
Dr.
up.
Dawson.
Dr.
Next
Doyle.
is
Dr. Dawson, thank you.
Yes,
And
thank
next
you.
up would be Dr. Doyle, Megan Doyle. She is our new Chief of Schools and Accountability, so welcome.
Welcome.
I'm gonna start slower, but I promise I'll go faster. And I realize that I'm between you, bed, and dinner. I don't know what in order that comes for you, but it's gonna come in some order for me. Good evening, members of the board. I just have an update on where we are with Orange County Schools Online Academy. As you know, the General Assembly provided opportunities for school districts to set up online academies or online schools this school year as a result of the experiences that we all had last year with online learning or remote learning, however it was labeled in different districts. But also because the General Assembly recognized that there were going to be still students and families who wanted the opportunity to learn remotely as we continue through the pandemic. We learned a great deal this last year, and the biggest part of what we learned is the fact that not all students are suited to online learning. And so Orange County Schools has done great work in a very short amount of time, setting up a school, which is Orange County Schools Online Academy. A great deal of work has been done, and there's still work to be done. Where we are right now is that an RFP for curriculum has been issued, and Dr. Dawson will be sharing a little bit more information about that. And that contract for curriculum is being presented to you this evening from Ed Options. School leadership has been identified, and Mr. Stan Farrington and Ms. Fournier. And these are 2 very dynamic leaders and a really amazing complementary team. Registration is capped at 150. We do have 152 students at this time right now. Some of that has to do with the initial kind of challenges with students starting to register at their home schools and then registering online. And so there was a couple of students who were lost, which is why you see the cap above that. You also see that we have a wait list of 16 students. And then also the school identity is being established. And it's really important, although that we're going to have an online academy and students will be getting their education from home, they want to build a school community and really come together as a group. And so Mr. Farrington and Ms. Fournier are working on that. And so where we're going is the website and Blackboard account so that they can communicate with their families, the community, stakeholders, and business members is being set up. Orientations have been established. As we said, curriculum has been identified. Now it's time for our schools to set up schedules for high school students, middle school students, and elementary school students, which you can imagine is a little complex in one school, but it's done in other places across the state, not just online, but in person. And they're communicating those expectations to families as well. Human Resources, they're coordinating many of the services like AIG, Exceptional Children, with the home or the sending schools, because no additional ADM was allotted for this school year. Obviously with the last, really the last minute push of the legislation, it's been very hard to kind of stand these schools up across the state. And then operations, meal coordination is being contemplated right now, which may also have impacts on Partnership Academy and how we do meals there to make it more efficient and effective for students. Well, which that's a benefit to all of the students there. And then thinking about when we do need to bring students and families together, where is that physical space going to be? And so a couple of sites are being contemplated. Mr. Obley, who has just begun, just like me, is working through those challenges as well. And so we'll continue to have updates to the board for those purposes. But just a little bit of information about the students that are going to be coming to Orange Online. We've got students from 12 of our Orange County schools represented. the largest coming from secondary, and that's middle and high school. Although we've got about 40% of our students who are elementary aged. There's one student right now, based on the data that Ms. Fournier has provided, that is paying tuition, and that's the little small light blue sliver at the top that doesn't have a label, is the tuition paying student. But you can see again that the majority of our students are coming from Orange High School. Enrollment by grade, you can see that there are peaks and kind of some strategic years. 8th grade being one, 10th grade being another. 4th and 2nd grade are some notable peaks in our enrollment. But middle school in general, with the exception of 6th grade, is a pretty large group of students that will be attending the online academy, and I don't think that's unusual. We see, especially in smaller districts, where students are with us for elementary school, and sometimes they make other choices for middle grades and then come back for high school. Well, our Orange Online is providing that choice within our system so they don't have to leave us, and I think that's a powerful opportunity for our students. The smallest enrollment is from our kindergarten level, and again, that's understandable as well, because as students learn how to read, we know that proximity to the teacher is a critical component in being a successful reader. And so obviously these are students that have a great deal of support from their homes to be able to make sure they master those skills. And then this just breaks down the enrollment again by school, but also by the specific grades that are being served in each of those schools. Again, the highest numbers of students coming from Orange High's 10th grade students, and there's nothing that we can say that's notable about that, except for those students evidently really responded well to online learning this past year and want the opportunity to move forward. So, and last but not least, this is the demographic breakdown of our students in terms of gender, race, and ethnicity, and then special services that they might receive on the campus. You can see that there's a little bit of a disparity in the gender of students that are identified attending Orange Online, but nothing significant. You will see though that the registrations by race and ethnicity do reflect a difference from what Orange County Schools overall shows. And so our Hispanic population is lower at Orange Online Academy, and then our African American, our Black population is higher than what's represented in Orange County Schools. Moving forward, we want to make sure that this school represents our school community, our greater school community, and so we want to make sure that those resources are available and accessible to all students in all of our student groups. But as we've tried to stand this up and realize and recognize that these are people who are asking us for this service, we're not necessarily soliciting from them at this point. We're still pretty much mirroring, at least representing all of the demographics, not exactly in the same proportions. And then finally, exceptional children, English language, and AIG services. You can see that there's a bit higher proportion of students or percentage of students that are exceptional children at this school. Again, I think some of that may be represented by the fact that these are students who may have medical conditions that prompt them to want to have online learning this year. But please know that we're working in our exceptional children's department to ensure that we're providing additional support for those students as we move forward. So with that, I'll take any questions that I can answer at this point with 2 weeks of experience in Orange County Schools.
You've done a great job.
One quick question.
Yes,
Thank you, Dr.
absolutely.
Bill. The cap, I know originally we were below our 100, and then we quickly got up to our maximum. I'm curious with the wait list, are we having any consideration of expanding, or are we staying with that cap of 150?
I think the cap, I think it is something that we need to consider. Obviously, that's up to the superintendent and the staff as we talk as a whole. One of the considerations though is every student that we add is additional cost. Orange County Schools has stood up this school without pulling ADM from the other schools, so everything we paid for in terms of leadership in some regards, as well as the curriculum, is being paid for in addition to what is already budgeted coming into the school system. And so as we consider opening up that wait list, we're gonna have to think about where those other resources are gonna come from.
Thank you.
That's a good point. Yes, Will.
Just a quick question. You know, we talked just a few minutes ago about the accelerated learning mini grants. Are we doing that as well for the online?
Orange County Schools Online is just like any one of our other Orange County schools, and they will have accessibility to the same levels of support for school improvement, but also opportunities to make sure that they are allowing their students to thrive and excel at their campus through the ESSER mini grants and the other resources that we have that we're providing to our schools.
Okay, excellent. Thank you.
Fantastic. Thank you so much for the presentation.
Thank you.
Dr. Doyle,
Oh,
just
yes,
a
ma'am.
question?
Thank you.
In the agenda documents, it showed some cost allocations, and it looks like there's some resources coming from our schools that are gonna help with the online academy, which I think is great. I just was wondering if we're gonna be tracking those with the online academy. So, for example, I'll make this up. If Partnership Academy is providing half a social worker to the online academy, will that be charged to the online academy?
And so, obviously, as one of our schools, it's not like we charge, charge to the school, but we are.
I understand.
We're aware and cognizant of the services that are being provided. And so actually, we've been talking about social work in specific today during our cabinet meeting, and the amount of referrals that we've had in the last 3 years for social work services specifically, to make sure that we have the correct allocation and allotment of those resources, not just at Orange Online, but across the system. So we'll be doing that with all of our resources, and I think that Dr. Felder has really charged us with making sure that the strategies we're putting in place are aligned to improving student outcomes.
Okay, I just wanted to make sure that that Partnership isn't paying for the online academy. Do you know what I mean? So just wanted to, and not to get into lots of minute detail, but if it's a half a person or a whole person from one place, and we need to know what it's costing us, roughly, that's all.
Absolutely, and we will keep track of that, and I understand the question now, I apologize for misunderstanding. And yes, right now, we are contemplating the same halftime position that was serving about 35 students at Partnership Academy will be expanded to the additional Orange Online students. But we are constantly evaluating those human resources to make sure that they're being leveraged in the best possible way.
Great, thank you.
All right. Well, thank you, Dr. Laurel. Thank you very much for that presentation. Very concise. All right. So, but next is the literacy across curriculum, because you pulled it, let's deal. Well, it was on the agenda before funding, but that's fine. Well, let's look, we need to do that budget, it was 35 minutes for that one, so it's not gonna take 35 minutes.
Okay.
But what we will say is, we will have to entertain a motion to extend, because we're supposed to end at 9, that's the end time, 9:30. It's 9:30 now. So, how long would you like to extend, colleagues?
30 minutes.
15 minutes? How long?
I said 30, but.
Of course you did. What about 2 hours?
How much time do we think we need?
Is this something that has to be completed at this meeting, Rhonda? Is it pressing before the next meeting?
There is a pressing component that if we could discuss, I'm happy to go right to that pressing component that we would like for approval this evening.
And is it my understanding that the rest of the budget presentation was to give the board opportunity to have the information now at the work session before you then vote on it at the next meeting? So that was the idea.
Yeah. Well, I'm waiting for a motion to extend, or we can just keep on talking then.
A motion to extend by 20 minutes, and if we need longer,
All right.
we need longer.
All right, so we have a motion, and we have a second to extend for 20 minutes. All in favor? Bonnie?
Aye.
Will?
Aye.
Sarah?
Yes.
Carrie?
Yes.
Jennifer? Yes. Yes. All right, so what time is that? All right, so, 9:50. All right, 9:50, that's fine, so it's on you, Rhonda.
Okay, I just wanted to make sure we were going here.
Yeah,
or
it's
the
on
big
you.
circle.
Go ahead.
Alrighty, let's see how fast I can talk tonight.
Well, it's on you, it doesn't matter, we have all night. I'm good, I don't have anywhere to go.
We're basically, I'm just going to bring you up to date from the last time that we talked about the budget. And as she said, this is basically just a discussion before we have our final budget approval for our budget resolution to begin our year. We approved at the June meeting a continuation budget, which allowed us to continue operating under last year's funding. Now we're just trying to get our final approved budget going for this fiscal year. We talked many times about the primary funding sources for school districts, and that's the state, the federal, and the local. I do want to point out here that the state represents just the initial allotments that we've received to this point. The same for the federal. The local represents just what we have received in our per pupil funding from the county commissioners. Does not incorporate any recommended fund balances, which we will be discussing, and hopefully we will get direction when we get final budget about going forward with those. As you know, students equal dollars for us in Orange County schools, and nothing has changed here. We still have our projected ADM, which was 82 below last year. Our charter students, of course, were an increase. We saw a decrease in our out-of-district students, giving us our total students for receiving funding locally as 8,110. The last time we were together was after the commissioners had approved their final budget, and we know they did not give us a per pupil increase. And so therefore, we have some unfunded mandates. We have our salary and benefit increases that we had projected at a higher amount when we went to commissioners based upon what we were hearing at that time and the governor's budget. We know based upon the Senate budget that is on the table right now, that it looks like it is roughly $400,000 less that it would impact our local budget by. We still have those unfunded hotspots, the service for those family liaisons. We approved fund balance for those last year. We did not get a per pupil increase, so therefore they remain as an unfunded mandate. So these are $1.2 million of the mandates that we have. We had expansion item requests as well that we had asked our commissioners for, and I won't read each of these out for you. I don't believe there's anything here that looks different from what we have already talked about. So we have all of these items that we will make a recommendation of which ones we would like to fund from where and which ones that we may put on hold. And we've had that discussion already as well. I want to start with our local fund balance. We began our fiscal year in 2021 with 6.1 million. Well, we're going to end our June 30th ending balance was $6.1 million. And it looks like we're going to put about $400,000 back into fund balance this year. As a result of the all of the CARES Funds Act dollars that we had, as well as the other funds that we had available to us, we were able to shift our expenditures where we utilized those to keep those funds from reverting, which actually left us spending and looking at the way our accounts payables are running, i.e. things that are coming in after the year end, they're not running as high as they typically have in the past. So it looks like we will add back, which will give us a fund balance of 6.5 million. There's 847,000 of those previously fund balance appropriations that we have not spent yet that we do recommend that they continue to carry over. A large portion of those is surrounding the safety fund balance for the safe havens, and we will be utilizing that for the Sonatrol annual monthly monitoring fee, which we will be able to deplete that fund balance in support of. So factoring those things in as we begin to talk about those previous unfunded requests, we have 5.7 million unassigned fund balance that we are beginning with. So therefore, it is recommended that we appropriate fund balance to offset the items listed here. Right now, we know that our potential impact to our local budget is $800,000 based upon what we know from the Senate budget. We know we have the hotspot agreements, and we know we want to continue those to be able to have our families have the option to be able to keep using those. We want to keep those family liaison positions, and so therefore we do recommend that we continue funding those. The school renaming, we have talked about. We are still estimating $200,000 as we can begin to get things finalized and projects finalized. We can have a better estimate in regards to that, but it's still, I do not estimate at this time that it appears we're gonna be more than $200,000. One thing that is added that is new for your consideration is the startup for our athletic programs at our high schools as well as our middle schools. Last year, these programs took a pretty big hit in the amount of funds that they were able to take in as a result of not having gate receipts or gate sales nor concessions. And they are in a place to start up a program with no funds. And they have asked the district if we would consider helping them by providing them funds to start those up for this fiscal year. Based upon where we've ended the year, it is my recommendation that we give each of the high schools $50,000, and right now, we give each of our middle schools $15,000, with the option that if those, in particular for the middle schools, that if there's data to prove that they, need additional assistance, which I don't have at this time, we can have those discussions at another time. We still want to restore those teacher assistant work days. We want to be able to offer professional development to the staff on those work days, and therefore we want to enable them to be able to work. Also, the part-time Karen and Burmese family liaison, that person to do that translation for those families that speak those languages. And then the 3 maintenance technicians. All of those items would give us a fund balance appropriation, new fund balance appropriations of 1.9. When you add those to what we're going to be carrying over and take away from what we have available, that'll leave us $3.7 million unassigned. I'm gonna keep rolling.
Okay.
Okay? Just a quick update on the state budget. As you know, we don't have one. However, we do have statute that allows us to continue operating based upon what our budget was for the previous year. So we are authorized to operate at that level. That's what they provided us our initial allotments on. Once they approve a budget, they will adjust us accordingly, retroactive back to July 1. I have seen, where they'll come in, if they give staff raises, they will make them retroactive to July 1. So our initial allotments that we received do incorporate the ADM reductions, because that's all we know at this time. There's nothing, we know the Senate has the language to hold us harmless, but that's not actually been passed, it's not actually in law. So based upon what we know from the previous legislation where we're funded at the same levels, adjusted for any increases or decreases in ADM, that's what we have been provided with. In regards to the state budget, I don't have any concerns regarding our initial allotments. I do have a concern if they don't hold us harmless for our ADM. When you look at our end of the year average daily membership in comparison to what we were projected at, we're off roughly 200 students. They will, if they do not keep that language, they will adjust us for half of the difference. And of course, there's always the loss of charter students if we continue to see that number increase at the level that it has in the past. Quickly, the Senate bill budget highlights. Average increase for teachers is 1.5%. A $300 bonus for all teachers and instructional support. They reinstated the performance bonuses, which they had taken away last year, but they have reinstated those for, if this budget was to pass as is. They had a $1,000 bonus for all full-time employees, so that would be your teachers as well as your non-certified staff that would get the $1,000 bonus. And then there's an additional $500 bonus plus you if, for those staff that are less than $75,000. So if you had a beginning teacher, an example could be a beginning teacher who would be below the $75,000 threshold, they would get a 1.5% increase. They would get the $300 bonus, they would get the $1,000 bonus, and then they would get the $500 bonus. And if they had growth in or performances in the AP, which are your advanced placement classes, your IB, or your CTE classes, they would be eligible for additional bonuses. This budget did have the held harmless language for our ADM, and it's estimated, factoring in those items for the people that we pay locally, that we're looking at an $800,000 impact to institute this budget. So the final component to talk about tonight, which I know we're all just really anxious to talk about, is federal. And I'm focused on the ESSER piece of it because that's the biggest piece of the funding that we're going to be receiving in the next few fiscal years. This is also the mechanism for us to receive our title funds as well as our IDA funds. However, our ESSER funds are making up a large percentage of that. We know that we have an additional $12 million that's being made available to the Orange County Schools District between these two funds. As you can see, these are the items that we are recommending that are funded out of each of these funds. Please realize that year 1, year 2, and year 3 are estimates, and if I may just give an example, on school mini grants, we have set aside $2.5 million roughly for our schools to have access to for mini grants. That does not mean that in year 1 we're only going to give $1 million. If they submit requests that are supported with their data and their needs assessments that are over the $1 million, we will proceed forward with making that funding available to them at that time. We will just, right now, based upon what we know, our target is the $2.5 million that we will issue the grants up until we get to that point. Some changes here. We added the online academy the last time that we looked at that. This was not on the table. We did add that. In year 1, you will see that the cost is higher. We looked at that cost at the 150 students based upon the contract and providing the full gamut of services available to all of those students. Also built in an opportunity for those wait list kids that if we did feel like that we could potentially address those kids that were on the wait list, we wanted to be able to leave the flexibility to do that within the capacity of the resources and the staff that we have. You will see that those costs decrease out in the out years because our goal is that we are writing those programs and doing that curriculum, where our goal would be that we would have our own curriculum as we continue to move forward with this, instead of having to rely on an external vendor to provide that. We also added 2 school mental health counselors. You've heard discussion in a few places tonight as we began to look at the data and our students who have returned at the year-round school and seeing the social and emotional needs of our students. We felt like that these positions were a benefit to our students and that they would be added in a capacity to serve, all of our schools. They would not be, I don't wanna say, I guess I envision them as based upon where the need is where they're going to go, and that they would actually be servicing our students. The final item tonight that we do need action on, is the recruitment bonuses. If you recall from the board abstract that was provided, we had recommended providing recruitment bonuses for these positions that we have identified that are being hard to fill. And those would include our 6 through 12 math. We had some CTE positions, our EC teachers from 6 through 12, the bilingual receptionists that we've had a very hard time filling, as well as nurse. We're having a hard time filling that position. And the dollars that are here are a little bit more than what was actually in the abstract, because we would like to be able to keep dollars available in the event that there are other positions that we're having a difficult time recruiting and filling. The other thing I wanted to touch on was the MTSS resources and professional development. I'm sorry I'm bouncing all around. That's what happens when I get in a hurry. The unfinished learning and accelerated learning that Dr. Dawson talked about earlier, the funding to address those components can be captured in this line item here. This is core as well as intervention services, and this will be our high impact tutoring, any new curriculum, those programs that were used in Summer Scholars Academy that our teachers and students really fell in love with, that they want an opportunity to be able to incorporate in their day-to-day learning. We want to have that option available should we see that that's the direction that we want to go, and that would be like NUVU, Sam's Lab, Smart Girls. We also, the ST Math and the Math 180. So those costs are incorporated in those funds. So in conclusion, the final budget, as we know it at this point in time, is a local operating budget of $37.6 million. This includes what the commissioners provided us for our per pupil funding, as well as those fund balance appropriations that we had recommended in this presentation. Our state public school fund at our initial allotments, our federal grant at its initial allotments. Capital outlay is going to represent what we have on our books for our CIP projects that are ongoing, as well as the new additional funding that we're going to receive this year. And then our other special revenue is our restricted revenue that is primarily made up of our it's our grants and reimbursements that we receive. This tuition is included in there, out of district tuition, our reimbursements from the county for our nurses and our school resource officers. Those are the types of funding that are in the other special revenue. That doesn't look right. So I guess I will take any questions that you may have on this presentation of this budget, with the intent that we would like feedback and approval to be able to move forward with the recruitment bonuses as recommended.
Okay, Will. Oh, no.
No, go ahead.
Let's do security.
Well, I think Will's doing the same thing, but a motion to extend. Do we need 10 minutes?
I don't know.
Do we need 10 minutes, everybody?
Yeah, we probably do.
Okay, I move we extend.
Okay.
We're going to do the Circa contract as well.
Yeah,
Okay.
for 10 minutes.
All right.
Second.
All right. So Bonnie, are you in favor?
Yes,
Thank you.
yes.
Thank you, Will.
Yes.
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 Yes. All right. We're in for another 10.
Well, I am done with my presentation.
Oh,
Thank
are
you,
you?
Ms. Rath.
Well, wait, you can't leave before
I'm
we.
not leaving. I'm right here to take your questions.
I know, I don't like it. We're gonna be here, you gonna be here.
That's right. I'm here with you.
Will and Sarah.
Go ahead, Sarah.
I just had a clarifying on the bonuses. So the proposal is, these bonuses, the chart that's in the abstract, if we hired someone for a math 9 to 12 position, they would be paid $5,000 the first year, $2,500, $2,500 for a total of $10,000. So we're offering essentially a $10,000 bonus paid out over 3 years. We are asking them to commit to 3 years.
That is correct.
Okay.
That is correct. So if they did not commit, they would not receive the rest of that. That is why it's referred to as a recruitment bonus versus a signing bonus.
Got it, that's great. And then I do think, so this, I think then that the total amount could end up being over this and potentially over that if we need to hire several middle school math teachers or high school math teachers, or, you know, if we need to hire several people in these positions, it would end up being more, right?
Based on what the estimate was based on, thank you for asking the question, is we looked at what we currently have vacant and what we currently have had difficulty hiring for. And that is based upon those positions, but in theory, yes, let's say if there was a mass exodus of more teachers in those areas, yes.
Okay, you know what, I realized, I thought that your total column and the total at the bottom 120 was, if you added up those numbers, but I just looked at those numbers and those don't add up to 120. Okay, great, okay, thank you.
Will, go ahead.
All right, continuing the recruitment bonus, you know, the 120 versus what's in the other chart shows 160. Is that the variable
Yes,
amount?
yes.
So y'all think it was 120 to 160 is the number?
Yes, in that range, and also to leave flexibility for us to be able to come back and maybe if we see other positions, for example, it was just noted today that it looks like science in our secondary is identifying as an area that we're having difficulty recruiting for and retaining.
Okay. I had one other
Yes,
question.
sure.
So on the athletics, I know you said that there's 50K per high school. I'm surprised it's not higher because I am familiar with, you know, I have older kids that graduated and I know the amount of money they have to spend on maintaining the fields for baseball, for football. Even though no kids are on there, they still have to, or it will cost way more than that. So are we going to give them what they need if they can prove it, or?
Yes, we looked at that data because, you know, you're right. For example, Orange High School, I think the estimate of the revenues that they were lost were up in like 90,000.
Yeah, I was gonna say around 80 is what I would guess.
Yeah, it was in the time, it was not that significant for Cedar Ridge. I also want to note, we do have grants in our local budget that are deemed athletic grants that are also given to these programs each year that help offset the cost of the officials. When staff looked at this and talked with the athletic directors, they felt good about the $50,000 to give them a starting point, especially at the high schools. Because, yeah, I was figuring I was gonna be looking at 100,000 for each of them.
That's, so they're whole then for maintaining it.
Yes.
Cause it's worse if we let those fields and stuff
I agree,
go away.
and, you know, I guess I would put the caveat that if the need is presented and verified, that I'm more than willing to bring it back to the board, for discussion.
Okay, thank you for that. It just seemed low to me, but thank you.
Do we have any?
Brenda?
Yes, Bonnie?
Yeah, I just, first of all, Rhonda, great job. Really impressed with, I think this is really beginning to take a shape that's making sense, so thank you for that. And it's really helpful to kind of put the MTSS, I don't remember, and the specialists and the mini grants together as our acceleration, our learning recovery plan. So that's now starting to make some sense financially to me. I'm worried about falling off a cliff. So if you look at the next 3 years, so we're funding a series of recurring positions with grant funding. And so you said earlier, or someone said earlier, that we have the ADM risk, plus we're looking at a series of full-time recurring positions that we're gonna be funding with the grant. So I'm a little bit worried about the risk that that's introducing, and I wondered if we would be starting to phase that out in the second year at least. And I'd be really nervous if we go into the third year with all these recurring positions funded with ESSER funding and not having a way to fund them in our recurring books. Did that question make sense to you?
Yes, it
You understand?
definitely makes sense, and I firmly can say that that is our approach as we are looking at these positions, is to, you know, reevaluate them and how they will be needed as we continue to move forward. As the positions are being hired for, they are being hired under the understanding that they are grant-funded positions. And that, so therefore, when the funding is gone, the position is potentially gone. With the intent of always finding options or other opportunities for those individuals in our district. And, you know, we want to take care of our employees and always will, but we will also be evaluating these positions continually with the intent of, you know, I guess you can think in some ways, as you put these additional supports and interventions in, you hope at some point you're able to get your students back to the point where we should be able to start backing down from some of those extra supports. That's coming from a non-curriculum person here, you know, a finance person. You
It's
know.
exactly the point. So I'm hoping when Dr. Doyle and Dr. Dawson put together the plans for the next meeting, that we begin to see kind of, I would expect a bigger push in the first year and it start to phase out over time as our students catch up. That's hopefully what we'd see. But this is good to get started. I also presume that these numbers will get assigned to schools, that we'll start to see it on a school-by-school basis. Is that right? As
Yes,
opposed
where
to
we have the
overall.
capability, we will always, because of the Every Student Succeeds Act, we will always do our due diligence to assign those costs that we can to schools.
Great, thank you.
Thank you.
And I motion to approve the recruitment bonuses.
I would love that.
Second.
Oh, any discussion? All right now, well, Maya, are you in favor?
Absolutely.
All right now, Will,
Absolutely.
Sarah,
Yes.
Jennifer,
Yes.
Carrie?
Yes.
Brenda, yes.
Thank
Oh,
you.
motion
Thank you.
carried, that's wonderful. And I'm just thinking, well, all this time, I should have turned that thing around, that way I could see Bonnie. Now the meeting is over.
Well, you still
Almost.
have
Almost. Almost.
I know, we have another one. Is that
1 minute.
Yeah.
So Rhonda and Mrs. Rath and Dr. Dawson will present on this day.
Okay.
Okay. So, I
Wait a minute,
believe there was
Will-
a question?
Yeah, I was about to say, would you rather me just ask the questions? That's what
Yeah,
you're
yeah,
saying?
I think
Okay.
so, if we just answer the question, because it might save us.
Okay.
Yes.
Okay, so my question is, when I read through this, it said, recommends board to approve the contract, and what's attached is a blank RFP and then a price sheet. So I'm not sure what we're approving. There's two options under the price sheet. One is paid yearly, the third is paid up front. So I'm curious, have you
Well, then that would be my fault.
reviewed the contract?
I haven't seen a contract.
That would be
Okay.
my fault.
Okay,
Because I thought I put all of them, so if I didn't put the contract, I apologize for that. Part of that contract is because we do need to get it through, so it would be that first, we would pay up 1 year at a time.
Okay.
That would be that contract.
Okay, so it would be the first one.
Correct.
The second question I'll ask versus us going through the detailed RFP here is, part of the RFP talked about, really seeing evidence-based Were they able to provide that as part of the RFP that showed their approach will show and has evidence from other districts and such?
Yes, so that's why we're going with Think Circa, because they are a research-based, program, and that's why we're going with them.
And I looked on their website, and they have some case studies and things there that are tied to outcomes like park scores. Park is like a big, like, common core, multi-state test, and like outcomes in those areas, because I had that same question. But they do on their website, if you look, they have some specific studies in other districts that show like real hard outcomes.
All right.
Does that satisfy you?
So, as far as the contract, I think, I know you need to get this in place, but as you said, the board doesn't have the contract in front of it, so
That's right.
perhaps you could approve the program subject to
Your review.
negotiation of a successful contract with the board attorney or whatever.
In your review, yeah.
Yes.
So moved.
Second.
All right, thank you. Any further discussion? All right, so we'll call for the vote.
Yes.
Will?
Yes.
Sarah?
Yes.
Carrie?
Yes. Bonnie?
Bonnie?
Yes, yes.
All right,
Thank you.
motion carries.
Thank you both.
Thank you. So now I'd like to call for another vote.
I'd move we adjourn.
Second? Do we have a second?
Oh, second.
Oh,
I thought you were seconding.
Yes, yes.
All right.
So any discussion? You have a discussion, Will?
No, I'm good.
All right, so. All right, so just kidding. We gotta laugh on it. All right, so we gotta vote now. Bonnie?
Yes.
Thank you. Will?
Yes.
Sarah?
Yes.
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 Thank you. Jennifer? Yes. And Brenda, yes. Thank you. Thank you all so much.
Thank you all.
Real motion adjourned. Meeting is adjourned. Good to see you, Patrick. Turn that recording off. Somebody needs to turn that thing off.
Yes, ma'am. Sorry
Mr. Jones.
Where's Mr. Jones? He needs to get in here.
Yes,
Could you turn the recording off, please, sir?
sure. Do you want to stop streaming live as well?
Meeting adjourned 5 minutes ago. Well, you can stream it all night if you like. Get out this place.
Just take it home.
You take it home.
I'm gonna put it in the refrigerator here, so you take it for lunch tomorrow.
I